Can you see my slide, please? Hello?
Yes, your slide can be seen.
Oh, okay. All right, thanks.
So hello to everyone who is on now. We're waiting for more people to join. Then we'll say our opening prayer and we'll start. So let's give participants maybe about the next 5 to 10 minutes and then we'll kick off.
Okay.
So team, kindly make me also a co-host. Thank you. Oh, okay. So that's Dr. Dami.
Yeah, hello. Yes, this is Dr. Damin.
Okay, wonderful. Thank you. You're welcome.
Thank you.
So, just as I said, I hope you heard what I said. You just wait for a few others to join, and then
that's fine.
Wonderful. Dr. Asayudi, you're also there. We have Dr. Samuel Mpansa also there. Thank you. And Goodwin Jackson. So, well, I think we can take this time. Yeah, we can take this time to also share the links with others. Dr. Amma, you're welcome. Naye kafu uji naye kafu hallelujah yasimha yetinyu tu. Sorry if you can't sing too. Yehudi, apologies. Konkrona ye, kosi se, yebe free ha, ye, hallelujah. Our Father, we thank you for this evening. We exalt your name. We say that you are Lord of Lords. You are the one who has made us. You are the one who has blessed us. And you are the one that has given us the opportunity to meet tonight. We pray and ask that all that we shall do tonight will be to the praise and glory of your holy name. And that information will be imparted to us, and that we shall benefit. And at the end of the day, we will go out informed and strengthened to know what to do. We give you thanks in Jesus' name. Amen.
Amen.
Okay. So we'd like everyone else to kindly mute their mics, and Dr. Pope will make a statement before we start.
All right. Good evening, everybody. Thank you so much for coming up again in this second and the last day of our health awareness program. We are happy to have you. So today we have in place very seasoned personalities whom will be introduced to you, and would like you to write up your questions as she speaks, and then we'll give you the opportunity to ask them after she has finished. I know today you would be really blessed as we listen to these seasoned persons. Thank you so much for coming. And then a special announcement, there's a special enrollment for the COVID vaccination ongoing currently at Noguchi. Those in Accra and those who are interested, especially those who never had the very first one, I'll put something on the chat. When we finish everything, you can go there and quickly enroll. In this special enrollment, you are sure to get all your 2 jabs at the right time. And so when we finish everything, you can visit the site I've put on in the chat and enroll. And I think that will be a blessing for coming on this platform to listen to this talk. Thank you very much. Uncle Nana, you can take over.
Okay, so thank you, Dr. Pope. We're going to listen to our speaker for today, our main speaker for today, or let's say the first speaker for today. And she's in the person of Dr. Odami. And I believe Doc will tell you a little bit about herself, yes, before she gives us the talk. So thank you very much for coming on board, Dr. Odami. You can take the airways.
All right. Good evening, and it's a pleasure and an honor to be with you all this evening. I'm Dr. Dame. I'm a pediatrician. I'm also an infectious disease specialist, and I'm a lecturer with the University of Ghana Medical School, also at the Korle Teaching Hospital. I fellowship with the Legon Interdenominational Church in Legon. And actually interesting, my sisters-in-law, they actually fellowship with your church. So your church is actually not so alien to me. So I'm glad to be here. So this evening, my task is to talk about coronavirus disease in children. And I know that I may be talking to different levels of specialties. And so we'll try to make it such that it will be more participatory. I'll do sort of an overview, and I want to leave time to be able to answer any questions, because when it comes to children, I always say that they're not just little small adults and you just give them half of everything. Children are also an entire entity on themselves. So for my outline, I'll look at an introduction, a brief introduction. How have children contributed to COVID-19 pandemic? Look at their signs and symptoms. How do we manage them? And we'll go a little bit into prevention in the school, outside, at home. How can we try to prevent COVID among children, including a word or two on vaccination? And then hopefully we'll have time for the Q&A session. So I want us to know that coronaviruses were there before we heard of COVID, so we have what we call the human coronaviruses, and this is a new strain of it. And as far back as the 1960s, when they were first identified as causing respiratory infections, okay, and up to 4 to 6% of all children who are in hospital at a particular period may have human coronaviruses. And because I'm saying human, because we have coronaviruses that are in animals as well. Now, in children who are less than 3 years, and especially those who have underlying conditions like heart disease, cancers, lung disease, they tend to be most affected, as well as the children under 3 years. And they have been linked, coronaviruses are linked to asthma and chronic obstructive pulmonary disease exacerbation. So what I'm saying is that even with this current pandemic, don't we hear about the children with asthma? They tend to have more disease, yes. So in general, human coronaviruses have been linked to asthma. So it's not surprising that this current SARS-CoV-2 is also seems to have an association with children with asthma. Okay, so human coronaviruses, as I said, cause of common cold. Children may just have no symptoms at all, or they may just present with a runny nose. So you have a child under 3, a runny nose, could be human coronavirus. There are other viruses, okay, but human coronaviruses are one of the things you think about. Nose congestions. There are some children who just come with wheezy. They are just wheezing, not exactly asthma. They tend to have wheezy conditions, sometimes called bronchiolitis or croup. They may have pneumonia. They may have diarrhea and vomiting, ear infections. All these are symptoms that may be associated generally with the human coronaviruses. Now, this current disease is caused by the coronavirus known as SARS-CoV-2. And the disease is the coronavirus disease 19. Of course, 19, because we all know that it came in 2019. And this virus belongs to the same group as the SARS virus. We've heard about when there was an outbreak called the SARS. There was another one called the MERS. So they are all within those groups. We know that it started from China. And I think this is a story that we are all familiar with when it was declared a pandemic. So the first question I want us to look at is, what is the contribution of children to this pandemic? You know, do we have a role? Why are we even doing this presentation? Should we be concerned about children? What we do know is that fewer children have been sick with COVID-19. I mean, you look at Ghana, you look in Africa, you look in the Americas, less children have been sick with COVID-19. And when we get infected, I say we because I'm a pediatrician, I call myself also a child, we usually get infected from the adults. But children, when they get infected, they can get sick and they can also spread. So even though we tend to get it more from the adults, we can spread it. Okay, children can spread the COVID-19. And it's a bit different from what we call the flu virus. If you are familiar with the flu virus, you tend to see that it's children who tend to pick it up. They go to school and they bring it at home and then they spread it. And then everybody in the family has it. But in COVID, it tends to be more of the adults who brings it and then the child gets it. Now, again, most children will have no symptoms, but they can still spread. They can have mild or no symptoms at all. However, unfortunately, some can get very sick, and we'll look at some of them. Some may need hospitalization, the ICU, or even a ventilator. And unfortunately, some may even die. So yes, we are seeing fewer children, but some also get very sick. And I know that in this country, we've heard of several people who have been ill, some who have died. It has happened to children, but on a less scale than it's happened in adults. The Chinese CDC reports reveal that only 2% of infection in COVID occurred in children who were less than 19 years. So again, look at the percentage, just 2%. And in another analysis, this was in America, it was only about 1 to 2% of cases. But what about in our own Ghana, right here in Ghana? Now this data is up to February 2021. Since the pandemic started, we had only 8 cases in my department. The 37 military hospital had more cases, 91. Children's Hospital, that is the PML in Accra, they had 24. Onfanochi Teaching Hospital had 20. Gold Teaching Hospital had 8. Tamale 15, and Holy Family. Again, if you look at this is less, but this is how we are contributing to this pandemic. Fewer numbers. Definitely. And of course, this is children 0 to 18 years. But why is this that children seem to react differently to COVID-19? So several theories have been proposed. Some have thought that because the children, they have other viruses. Remember children going to school, they'll keep coming home with all these recurrent respiratory infections. So already there are viruses there already. So it's almost like you SARS-CoV-2, you have come to meet us viruses there already. So we are all going to compete. We are all going to fight within the lungs. And so the strong ones are there. So there's competition going on there. which again tends to be a good thing. There are differences in the immune system, okay, that may be more robust within, depending on the system and the immune system. Also, even it is difficult to take a sample. Sometimes, we have to do the nasopharyngeal, and any of you who have had a COVID test just knows how uncomfortable it is, even on yourself. Imagine doing this in children. Also, we know that from the adults' data that more people with diabetes, hypertension, heart disease have been infected. But in children, there are less of these chronic health problems. So not surprising. So who knows, maybe the children have it, but we don't even pick it up because we are saying that they even have less chronic health problems. And again, a child is not likely to be looking after an adult with COVID-19. So again, because that happens, then he's not less likely to pick it up. So all these are different reasons why they think that children react differently. Another important one is what we call the angiotensin converting enzyme 2. Now, this is an enzyme. So this is like a protein, something that the virus needs. We call it a receptor. Before virus can attach or be within your cells, it needs something to hold on to it. Now, this thing that needs to be held on is not so mature in the airways of children, which becomes a good thing. And we see that the way that disease is, the parts of the body that has this enzyme tend to have more disease there. So of course, even the children is not very mature, then you're not going to have a lot of more disease. So these are some of the reasons that have been. I like to show this slide when I discuss. I just want us to look at airborne and droplet transmission, because it's important to understand why we started saying keep 2 meters away from each other. Keep at least minimum, some will say minimum, but to be on the safe side, they will say 2 meters. So the reason is that when we talk about droplets and we talk about airborne, and so the question also was, is SARS-CoV-2, that's COVID-19, is it airborne or is it droplets? It's an important thing to pick up because depending on whether it is droplets or airborne, the way you protect yourself is different. A lot of data, a lot of statistics has gone on, and at the end of the day, it is thought that it is still generally droplets. However, under certain conditions, it becomes airborne. Now, when it is airborne, it means the way you need to protect yourself is more. And these are some of the diseases that are generally thought to be airborne. So generally, it will be droplets. And droplet means when you cough or you talk, the particles will drop small, just within 1 to 2 meters. And so that is the reason why the physical distancing is up to 2 meters. You and I should be 2 meters away from others because it is droplets. When we talk about airborne, you see that the person who coughed or talked was able to travel for longer distance, and sometimes it travels even across rooms. Okay, that is why when we manage people with TB, we close the door because it's one of those conditions that is airborne. But the droplets just fall straight and it can touch a table or a surface. So this is when we discuss, so is it airborne? Or this is the reason behind the way we have to protect ourselves, and especially my emphasis is on physical distance. Again, this also just describes the way it is transmitted. And that is why we have to wash our hands and we wear the face mask. So we are close to somebody, the person is talking, so we must wear the face mask. We must frequently wash our hands because who dropped it, maybe he dropped it on a table, and that is when it's contact. When he drops it on a table, it just went straight. Remember, just 2 meters, but straight down. And you touched it and you did not wash your hands. It may go to your nose, you touch your nose, your eyes, your mouth, and you get infected. And so that is the contact. So you need to, that is why we need to hold the physical distance, the face mask, and then also the hand sanitizer is very important. Now, what are the symptoms of COVID in children? Just as in adults, they also have fever, they may have cough, shortness of breath, or difficulty in breathing. Just really chills, really cold, like somebody who has malaria. There have been a few cases where people have been treated thinking it's malaria, because in this country, commonest reason for having chills is malaria. especially if you have chills and you have muscle pain. Oh, it's malaria straight ahead. They may have headache, sore throat. So they have all the similar symptoms to adults, but generally, as we have said, it's not as severe as even though a few may have severe illness. There's also the new symptom that was discovered because people were gathering data during the pandemic, and that is the new loss of taste or smell. So suddenly you cannot smell your soap. Suddenly you cannot smell your perfume. You cannot taste what you're eating. That's children also can get that. But there are some children who may have more severe disease. And one of them is babies who are under 1 year. I remember that in a number of children that were managed at an isolation center, the only baby who needed to be taken back to the hospital was a 3-month-old. All the others were able to go home because their disease was mild, but the baby, 3-month-old baby, got more sick. Okay, so babies under 1 year are more likely to have severe disease. Again, those with asthma, chronic lung disease, diabetes just in the adults, heart disease, and those with cancers or HIV, those who are obese, just too fat. Yes, all these people may have severe disease when they have one reason or the other. So in my department, this is where I work. Out of children that we had, the mean age was 8, the youngest was 19 months. 2 of them had asthma, others had fever, cough, sore throats. One of them had what we call encephalitis, that is infection within the brain. Unfortunately, that child died. Others had severe pneumonia, and also 2 others died. They had cancer, and it was unfortunate. They had very, very bad lung disease, and they died. So again, immunosuppression here, as well as, getting COVID, puts them at risk. So this is just showing an X-ray of a 3-month who died. Sorry, a 3-month-old who died. Very bad X-ray. The lungs were almost like, nothing was going through. It's really stiff lungs is what it was called. Other children may also have rashes, so we have noticed that COVID in children may present with rashes. It happens in adults as well. But one other symptom is eye infection, where the eye is just so red. It may just be what the child may have. So a child with a positive COVID test may just have a red eye. And that is also one of the symptoms. So, sorry, just 1 minute here. The children are making noise, just 1 minute. Sorry. So COVID, we had an isolation center at the Pentecost Convention Center, was donated to Ghana's Ministry of Health to be used as an isolation center. Within a certain period, over 4 months, we had 91 people, children who were admitted there. Okay, their common presentation was really headache. They were cough. So they had some of them also had what I talked about, the loss of smell and the abnormal taste. We also saw a child who had this red eye, as I talked about, and this is one child who had to be transferred to the treatment center. This is what the Pentecost Convention Center looked like, and it's a very beautiful place. I'm sure some of you have heard of what we say MIS-C, that is the multi-system inflammatory syndrome that is associated with COVID-19 in children. Now, as the pandemic was rolling on, it noticed that some children were developing a certain severe illness, and that was sudden, because all the while, what have I been saying, that children have less severe disease, children don't get as sick as adults, but suddenly they saw children with a particular characteristic of disease, which is akin to a disease we already have in pediatrics known as Kawasaki disease. I'll not bore you with that. So it was sort of like Kawasaki disease. So initially it was known as Kawasaki-like. But then later it came up with its own name, and it's a multi-system inflammatory syndrome. And we know that these are children who may have had COVID. So it doesn't mean they have COVID right now, but they may have had COVID, or they may have been around somebody who had COVID. and it affects the heart, the lungs, the kidneys, the brain, the eyes, and it can be quite serious. But most children, once you diagnose and pick it up, so this is how it presents. The child may have the fever, look at the hands, swollen, peeling, the eye will be red, they'll have the rash, swollen hands, you know, and they are generally quite ill. And that is how that disease that I call Kawasaki also presents. So this disease has come to stay. I mean, it is something that all countries are supposed to gather data on. And so far, we have also seen 2 of them in Ghana here. But how do we manage COVID in children? It's very important that you pick them up. You have to identify and do what we call isolation. Because as I mentioned in the earlier slides, children can spread COVID. Okay, so if you have it, just as you have to isolate, you need to also isolate a child. And how long do you isolate that child? Currently in Ghana, depending on if it is you have symptoms, it will be 14 days from the day you had your first symptom. If it is somebody with no symptom, then it will be 14 days from the day you did the test. So that is the period. Previously, we had to repeat the test and repeat the test. Now we don't have to do that. We just use what I'm saying. If you have no symptoms, then it's 14 days from the day you had the test. And if you had symptoms, it's 14 days from your first test. If somebody is in has difficulty in breathing, the person needs oxygen. Please, the oxygen is not in your house. The oxygen needs to be in the hospital facility. So the person needs to be managed in the hospital. If it is mild, the person can just be managed at home. I also want to say that you don't just start every child on azithromycin who has COVID. We use azithromycin when we think there could be a pneumonia. We use it when the person has it's more ill, because we have people who just have a COVID test and they start azithromycin. What happens with that? Azithromycin is an antibiotic. It's a good antibiotic specific for some kind of pneumonia. But unfortunately, we abuse it during this pandemic and it loses its use. Then we are going to be in trouble. And a lot of studies have been done, and so far there's no recommendation that says that somebody has COVID-19 just starts azithromycin. So in order not to abuse antibiotics, you need to visit the healthcare facility and they tell you what to do. You don't just start managing on your own. So other treatments, also steroids. And again, we see that people just start prednisolone as soon as they have COVID-19. And in my next slide, this is one child, a 3-year-old, who had a positive COVID test. The only complaints was a runny nose. The patient developed diarrhea after 2 days. The child was on Calpol. Okay. Prednisolone was started. Hydrochloroquine was started. Actually, Zithromax was added. He had his Zincovit. He had his Augmentin. And now the child developed the diarrhea. Oh, yes. And let's not forget our favorite neem tree juice. So now, which of these things has caused the diarrhea? We know that Augmentin can cause diarrhea. We know that Zithromycin can cause diarrhea. Well, I don't know about the neem tree, but we know that COVID-2 can cause diarrhea. So this is somebody who just started with a runny nose. 2 days later has become quite ill with the diarrhea, becomes dehydrated, now needs fluids, needs to go on admission. So we just need to be careful and not get ahead of ourselves. The child needs to be seen. You need to talk to a healthcare provider and not try and manage the child yourself. What about the breastfeeding and manage as we talk about management? If some mother has COVID, can she breastfeed the child? Yes, you can. You can breastfeed, but still apply the necessary infection prevention and control practice. So you see this mother, she has her COVID, but she's nicely breastfeeding the child, wearing her face mask, okay? And of course, we need to provide counseling, but of course, that is we, the healthcare providers. We need to make sure that the mothers would have received some kind of psychosocial counseling because they are going to be concerned. And why are they going to be concerned? That's my next question. Can COVID-19 be passed through breastfeeding? Up to date, it has not been detected. Studies are still ongoing, and even there's one big study happening in Ghana right now that is going to look at whether COVID can be passed in breast milk. So currently, it's actually unlikely, and that giving breast milk would, by a mother, will pass the virus into the child. But as I said, studies continue to be done. So mother who has COVID-19 and who is well, of course, if the mother is very sick, just like any other mother, she may need to express, and then somebody may give it to the baby otherwise. But once the mother is well, and of course, if the baby is also well, let us say that mother is well, baby is well, she can safely put the baby to breast while wearing the face mask. Now let's look at prevention. The best way is to avoid being exposed. So what does that mean? Staying in your house the whole time, which is practically impossible. Now schools have opened, churches have opened, Sunday school is going to open, and I'm waiting really for my church for Sunday school to open fully. And so children will need to go out. So how can we prevent it? These are some strategies. I call the first one, they should stay home when they are ill. So if your child is going to school in the morning, it's good for us now to be more observant, okay? We mentioned all the symptoms. If your child has any of these symptoms and you are concerned, please, the child should stay at home while you may observe. If the child even is sick with any other condition, the child needs to stay at home. A child who is in school and develops symptoms, you need to call the family to pick up the child right away. And if possible, the child may need to use a face mask. Now, so some of the things that we do is we call this the morning health check. So that you want to understand the child better. So you look out for signs. It's called the using your senses, okay? You're looking out for signs, listen for complaints. It means that we have to be more observant, smelling any unusual odor, and ask if the child has a fever or actually check for it. Look out for their general moods. So we just need to intentionally do this morning health check every day. Make sure that, because you don't want your child to go to school, infect another child, and then it becomes a chain and that needs to be managed. The second is to wear a face mask. So you stay home when you're ill, but otherwise you need to wear a face mask. Now, must all children wear face masks? That is the question. The baby is going to wear face mask. Are the 1-year-olds going to wear face masks? What does the CDC recommend? They say that children 2 years and above should wear face masks. You see, I know that some people don't know. We need to do more education, because sometimes in a hospital, I have had to remove face masks from babies. A mother brings a child to the hospital and the child is wearing a face mask, a little baby less than 2 years. It's not safe. It's not safe because there's a danger of suffocation. Now, even WHO recommends, in WHO's guideline, they say that children age 5 should not be required. They use the word should not be required. So it sort of gives you a leeway. But everybody knows that less than 2 years should not wear a face mask. Now, I also want to add that in children who are struggling to breathe, so somebody even becomes unconscious, do not put on a face mask. Somebody with severe asthma comes in, do not put on a face mask, because you are even compromising the airway even further. So those who are critically ill should not be. And even when you're wearing a face mask, you yourself and the child, you need to communicate that when they begin to feel uncomfortable, they need to tell you, and they need to know how to remove it. So the child doesn't think that, oh, no matter what is happening to me, I should always wear a face mask. Yes, wear the face mask, but you should explain that there's that leeway. So how can face mask be worn safely in children? Before you touch any face mask and before they do, they must perform hand hygiene. That is the safest way. So that is hand wash their hands, or they go and apply sanitizer from adults. If the teacher or parents, don't just yank the face mask, put it on like this or do that. No, you need to also perform hand hygiene before and after helping a child. As much as possible, do not touch the main mask. Try to touch only the ear loops or the ties, because the main mask may have been a port of entry for viruses or anything, and so you should not touch it. It's a good idea that your child is going off. Send them with about 2 or 3 extra masks in case it's wet or it's dirty, and you should give them something that they can store the face mask in. when they are eating, by all means, they must remove it. And that is when, if they have a nice container or the paper bag, we can put it in. Children should be seated 6 feet apart from each other, okay? And actually, outdoors is even better. Okay, there's great ventilation now. We know that they should not be sitting in crowded rooms with air conditioning and all, especially during this pandemic. Now, how can you and I help the children to get used to their mask? Suddenly, the child has to wear a mask. It's daunting, a daunting task. Okay, now schools are fully open. I know they've been doing it, they've started doing it, it's going well, but we need to keep emphasizing on it. You can practice, we can all wear face masks. Okay, so today is face masking day, and you and your family do it together. You may put a mask on a child's stuffed animal. You can put it in their, buy mask in their favorite colors. So imagine Elsa face mask. You know, these are exciting colors. All these things, children, there's Spider-Man, you know, if they have these face masks and sort of more exciting and they are able to, so just create ways to make it interesting for them to be able to wear the face mask. This is personal hygiene, that is frequent hand washing and coughing into a sleeve. Now, when we talk about hand hygiene, it also includes the use of hand sanitizers. I know that now the children, as they enter school, and they use the hand sanitizer. And I always have to tell them, those applying that, please be careful, because it has to be at a distance, not so close to them. You may even spray into their eyes. So these are some of the things we should also be careful about. These are hand washing steps. You can place it even at home, just to encourage the children as well. But a caution here, and of course, with the infamous Trump speech, that is also another thing. But apart from that, there has actually been a rise in accidental ingestions by children who have ingested hand sanitizer. Imagine that the alcohol ranges from 40 to 95%, ethyl alcohol usually. By comparison, I mean, bottle of beer is about 5 to 10% alcohol, and wine is about 10 to 15%, okay? So this is about 40 to 90%. So we need to be aware, because there's been a rise in it since this pandemic. I mean, it's all about sanitize. So how can we prevent hand sanitizer poisoning? Keep them out of reach. They need to be supervised, okay? You don't just put a hand sanitizer. You need to talk about it. You need to make sure it's in a safe place, and you need to supervise them. You monitor the use of it. You tell the children to keep their hands away from their faces, their mouths. Of course, this will prevent disease and also ingestion of the hand sanitizer. They should also wash their hands more. I know when I say that and say that, oh, there's no water, well, that is unfortunately the problem. But if there isn't, of course, you have to use the hand sanitizer. But as much as possible, you should also wash their hands with soap and water. So just remember that hand sanitizer poison is on the increase, and it's something that we should look out for. So this is a video that I'm hoping to show just when I end. It's videos for children, funny things to help them to wash their hands well. They should cover their cough and sneeze, ways for them to protect. So all these can be put at places where the children are, even in their room, just to remind them, okay, in school. I'm sure school have them, but these are important for children to prevent. Then we come to cleaning and surfaces for children. When we talk about cleaning, we mean we are removing dirt, debris, sticky film, washing, we are wiping, and we are rinsing. And when we disinfect, we are using something to actually kill just the germs. So they may just remain on it. We have just disinfected it, okay? That's the difference. There are some things that should be cleaned, the toys, the bedding, the floor, the clothing, cribs, their cots. You know, you're not just going to apply sanitizer to their clothing, you know, their play equipment. You need to actually clean these ones. Some things can be disinfected, like drinking cabinets. We know our doors, they are high touch. At home, we should do that often, so that when the child touches it, you know that the risk is minimal. We minimize the risk as well. These are other things that should be disinfected. So before you disinfect, you ensure that the child is not away. First, you clean. Okay, it's always important to clean first, even when you're going to sanitize. Then you need to read the product label. many a time we just apply the sanitizer and then we come and clean. But there's actually what we call the appropriate contact time, which is important because depending on what the users, oh, I'm trying to kill bacteria, I'm trying to kill viruses, there's what we call the contact time. So you need to set a time, and after you have applied disinfectants to the children's surfaces, and then after the time is up, then you air dry or you wipe. So you don't just apply the disinfectant or sanitizer and then wipe. You read the instructions, you clean appropriately. Always use caution. I've mentioned this, even the way when you're using sanitizer, not too close to people's faces, their nose and their mouth when they're spraying. We need to be mindful. And, especially when we have gatherings, everybody's coming in, just spray. We should be mindful of where we are spraying. You should, if you're disinfecting a place, you need to use what we call personal protective equipment like gloves or sometimes eyewear. Make sure the child is not there. One thing I've found is that never mix ammonia or vinegar with bleach. Bleach is a disinfectant that we also use that is used at home, okay? Never. Sometimes you want to get a very strong reaction, you really want to clean, but this is something that should never be mixed because you get dangerous fumes that can kill. So it's very important not to do that. Use their clutter. Don't discourage items coming from home. They shouldn't send toys to school. You should store things. This is the time we should reduce our clutter. I always say that the COVID has come with, it's not good, but it's come with something that we have all learned. We've learned how to really wash our hands. We have learned that how we should cough, how we should sneeze. These are things that we should have done already because the human coronavirus, I told you, have always been there. It's the same way to manage them. The other viruses, but we have become more aware. They're sanitizing more often, so that's a good thing. You should store things you don't need. Reduce clutter because everything traps something. Okay, so these are important things for us. Then, of course, physical distancing, and I explained why we need that 2 meters distance in that schematic diagram that I shared. Also, limit non-essential visitors. I know that Ghanaians, we like hugging and shaking, and it hasn't happened in a while. We should refrain from it. And I even say that the whole idea of even elbow shaking, I mean, if you're going to elbow shake everybody, imagine a number of, especially when you're not wearing anything on, you're still collecting things on your arms. So I just tend to do a little bow. Keep group sizes small and stable. Try to assign groups their own room. So siblings together as much as possible, depending on if you are it's in school or even if it's in church, Sunday school, try to put siblings together. Don't mix groups. If it is one group that you have had, then try and maintain this group throughout. The reason is that so that you can, even if there's an infection among one of them, within that same group, you can pick it up. But if you put this group and the next time you add another group and you mix them, then you're going to really spread. So as we open Sunday school proper, these are things that you should remember. This goes without saying. Arrange furniture to give them more space. Open windows for fresh air. This will be in school again. And cots and cribs, a good distance. Children facing head to toe as much, but I don't know how possibly the child during the sleep will turn around. There's not much you can do about it. But the whole idea is that they are not facing another child so closely so that they are not breathing on anyone. At meals, they should sit apart. Do not pass food in common serving dishes. They're using disposable plates. I think the schools have told us, bring your own cutlery and all that. And when we are serving the food, we need to wear gloves. Activities that will limit close physical contact. So the other games that children can play, we can play with them at home. And my daughter likes the Simon Says or Follow the Leader and all these other things that don't need physical contact. So the whole idea is that we are trying not to touch people. We are trying not to touch one another, and even in children, this is important. First, they used to brush their teeth in the classroom. Sometimes they say that they are practicing how to in the younger ages. We don't need to do that anymore. As I said, hacks and all these things. Let's put these things on hold. Now, finally, can children get vaccinated against COVID-19? Is there any vaccine? Now, children 12 years and above can be vaccinated with the Pfizer vaccine, which has just been approved for children 12 years. So previously studies were going on. The AstraZeneca vaccine, which we are using in Ghana, is recommended in children 18 years and above. There are ongoing trials to include younger children. When it comes to vaccination, I always say that when you have the opportunity to get vaccinated, you should. Because when we get vaccinated, we protect those who cannot get vaccinated. So let's talk about the child who I said had cancer and died from COVID. Now, this is a child who was having treatment and was actually doing well. And this looks like an infection that he probably picked in the hospital, okay? And unfortunately, you would have picked it from a healthcare worker or from another family, another parent. But what if all those people had been vaccinated? It would have prevented that child from developing COVID, getting COVID and dying. So when we get vaccinated, it's very important because we protect the vulnerable. So in summary, children are just as likely to get infected. Yes, we can have infection as well. We have less symptoms, we have less severe disease. Unfortunately, we also die less. But those who have certain underlying conditions may have severe disease. We know that children can transmit, but how important that is within this current pandemic is not known. And unfortunately, there's a double jeopardy for children with underlying medical disorders. And the double jeopardy is that especially during the pandemic, they couldn't even access their drugs, okay? So there was lockdown and all that. I pray that we don't get to that situation again. But again, they are also the ones who tend to get more sick, which is very unfortunate. And so these are my references. Thank you very much. And I'd like to take any questions that you may
Thank you very much, Dr. Dami. Dr. Dami is a consultant pediatrician and also an infectious disease specialist at Korle Teaching Hospital. If we have questions, kindly let us. You can raise your hand or you can send a message to the chat room. Yeah. So we are expecting questions, please. Any questions? Okay, Dr. Dami, I think I'll start with a question. You spoke about disinfecting clothes. Hello?
Yeah, hello.
Yes. What
I'm
do you
listening.
mean? How do you disinfect clothes? You know, our children when they go to school and come back.
Okay. Sorry, so I actually said the clothes is one of the things you don't disinfect rather, but
Okay,
you wash.
you don't.
You clean.
Okay.
Yes. Sorry if you didn't get it right. I mean, you don't. I was talking about them. These are not things that you are just going to say I'm disinfecting your clothes, but there are some things you actually have to clean, and that clothes fall into that category.
Okay, so drying in the sunshine or hanging in the sunshine won't help. Is that what you're saying?
Absolutely. We know that we don't always every day. We are not washing our clothes every day, but I'm coming in the context of when you decide that I'm going to disinfect my clothes. That's what I mean. That you don't do that. You need to actually wash them. And yes, we talk about drying in the sunshine, but all those things we don't have much evidence as to, because there's always been that sun theory. Why is it COVID is not so much in Africa? Is it because of the sun? We really don't know. So as to whether that is a COVID, something specific for that, we can't really tell. But yes, it's something that is useful to do. It's useful to hang your clothes outside, dry them, and in the sun. I mean, you've come from school, this is not something you're going to wash your beddings. It's important to dry them in the sun.
Okay, I really wanted that because I wanted something practical that parents could do. You know, you have your children coming, you can't wash maybe every single day, but
exactly.
You could.
Yes, exactly. And let me just also add that another practical thing when you mention it from school, when they come home, let them have a bath immediately. When you come, there's no, because they are going to have it anyway in the evening, are they not? So they've come from a program, they've come from school a long day. It's useful to let them have a bath immediately, just clean up and for anything else.
Wonderful. Any questions? Otherwise, I'll continue to ask Dr. Dami my question. Okay, Doc, since you're a specialist with children,
Sure.
you know, in the initial stages of the COVID, everybody was afraid. Children were very much afraid and so on. But now, after a while, it seems like the attention or the focus on the preventing things seems to have come a little bit. How do we keep the attention of the children um, there to be cautious, still to be cautious?
Yeah, absolutely. Thank you. It's just the education. And now that they're in school, one of the major areas will be from school, but then also the role of parents is very important. Now you see that they're not even wearing the face mask. Those who can wear it, they're not wearing it as much as they should. Because there's just that general laxity everywhere. They see their parents doing it, they see others doing it. So we just really need to intensify the education. Others have had second wave, third wave, and what have you. It's important that we don't get there. We talk about different strains. We just need to maintain the momentum until they finally call this pandemic.
Wonderful. So, Doc, if
Yes.
it so happens that you observe symptoms, but as a parent, you know, sometimes parents are afraid to go and do tests. Yes. Would you advise parents to start doing vitamin C and zinc and so on?
Okay. So I would always advise that it's important that you see a healthcare provider. I mean, I know that sometimes the inconvenience of if somebody said, oh, even if it's me, Dr. Dami, where do you work, Kolebu? And people will whine, all the way, Kolebu, don't you go to another place? I get those questions all the time. And so because of that, we just want to do their own thing. But I think that the first thing is to get a healthcare provider. All these zinc and vitamin C's, especially vitamin C, previously the common cold like flu, it's sort of thought to have some benefits. And again, some studies had shown also within COVID that some benefits, nothing so conclusive, but let's be honest, we all do it. The vitamin C is harmless anyway. And well, to an extent, because you can overdose on it. So vitamin C and zinc. Zinc boosts your immune system. So yes, zinc is also a good thing when you have respiratory infections. But to the extent that you just sit at home and do that, because when are you even going to de-isolate? You mean come out of isolation? These are important things. So even if I would always advise that get the test. If you think that the child is not so ill, you can look at the symptoms. If it's like the child I presented, it was just a runny nose. The child, you look at the child's breathing and you're sure you can discuss with a healthcare provider who can advise you. I mean, there have been children who have managed just on phone because, I mean, you ask the right questions and you see them. And these times you can even do a video with the parents. There are so many innovative ways. COVID has shown us a lot of things, but as much as possible, always, not as much as possible, talk to a healthcare provider.
Always. All right.
Yes, always. Yes, always.
Okay, so parents, I hope you're listening.
Yes.
Always talk to a healthcare provider.
Oh.
Well, by the grace of God, we do have quite a number of medical people in the church.
Yeah.
So I think I'd like to take this opportunity to tell parents that don't hesitate to call the Dr. Popes, Dr. Granting, so many people that we can call. Auntie Alma, Dr. Amma, Cancer. I mean, there are so many. There are so many people that we can call. So don't hesitate. And I think we should tell our members the same. Do not hesitate to do that. Yes, we're still waiting for any more questions before we go on to our next speaker. And the question does not, anyone, we have people who can answer some of those questions. And okay, I can see a hand up. Let's see, where's the hand? Yes, we have Godwin Najite Jackson. Please go ahead and ask your question. Hello, Godwin. Hello, Godwin.
Hello.
Yes, wonderful.
Good evening.
Kindly ask. Yes, good evening.
Please, she spoke of hand sanitizer poisoning. I just want to know how that take place, please.
Okay.
Okay, thank you. So it's really by ingestion. It's unfortunate, but it's by ingestion where it is so close. And poisoning is one of the things, accidental poisoning is one of the things that in pediatrics we always have to battle with. Accidental poisoning of kerosene, accidental poisoning of soaps and all those things. So, and unfortunately, COVID sanitizers have come to it because of the influx of it. So it's just for us to be aware and to pay special attention. And because even sometimes, you know that we have, some are quite more fluid than others. Some are more fluid than others, where it's all sanitizer. And some people even Baltic bottles or other bottles. So we tend to have that kind of, it's always by ingestion. Quite
Okay. Thank you very much.
Yeah.
Yes, Mr. Jackson. Hello, Mr. Jackson. Okay, so I want
Yes,
to
sir.
believe
Yes, sir.
your question is answered.
Yes, please. Yes, please.
Okay, thank you. Okay, yes, do we have any more? Maybe one more question, and then we'll...
Oh, I
Yes.
hope I have not confused people.
No, if you want to explain something again, you may do so. But Godwin's hand is up again.
Hello.
Yes, Godwin.
Yeah. Please, I want to also find out, my experience with this COVID thing is that most time we get to a place, we are made to wash our hands, we wipe or clean our hands, and then we are made to hand sanitize. If you wash your hands with soap and water, is it necessary to apply the sanitizer? Or if yes, then what is the role of the soap hand washing? And then what is the role of the hand sanitizing?
Thank you very much. And you are absolutely right. There is no rule for doing both. It's actually just a waste. It's either or. There are times when even the healthcare center will say that this time you really have to wash your hands. There's been a spill. Maybe there was blood or something. Okay, those times you have to wash your hands. But even we don't do both. And so I think it's just a bit of overkill, and pardon those who do it because of this whole pandemic. It's new and all that. The sanitizer helps you to make it more rapid. You do it faster, but you don't need to do both. But I'm sure that if you go to a place and you start arguing, then they'll say these are the rules and all that. But really, as we educate, these are some of the things. It's really you're wasting it. You don't need to.
Okay, Doc. Since you mentioned,
can I add something to it?
Okay, yes, go on, please, Doc.
Okay, Josephine, thanks so much. I think we have to make it clear that at the point where you are washing your hand, you don't need to use a sanitizer. But anytime you touch something and there's no soap and water available, you have to use sanitizer. I think that is the distinction we need to make. Otherwise, somebody will have washed my hands in the morning. So you'll be touching things during the course of the day and say, once I've washed my hands, I'm okay. But the essence of the sanitizer is that when you touch something, you don't know whether the thing you are touching is harboring COVID or not. So you use a sanitizer immediately if there is no soap and water. But as Josephine said, you don't need to do both at the point in time. It's useless. Thank you.
Okay.
Thank you. Yeah, absolutely right. And yes, he's absolutely right. That's it. Like I said, the sanitizer is just a quick way. You just keep doing it frequently. But I know that there are places, and even in my church, you wash your hands and then they give you the sanitizer as well. But you don't need to do both. The sanitizer is just something you just keep frequently doing, because as like I said, you even touch your mask. If you touch your mask, you have to apply hand sanitizer. Let's say it's communion time, and then you touch your mask. Are you going to go outside and wash your hands? No, that's where your sanitizer comes in and all that. So yes, both are important.
Doc. Hello, Doc. Maybe
Yes.
this will be the last question.
Sure.
You spoke about overdoing these things, but I want to ask you about the double mask. Can you say something about, is it good to let children wear double mask? Maybe a parent and you feel that your child really needs to be protected, so you insist that your child has to wear the double mask. a KN95 and then maybe the surgical mask together.
No, you're even laughing. No, I do not recommend. I do not recommend double mask in children. And no, I mean, even in children, look at the WHO guidelines says that even in children under 5, do not have to, you see, but of course, do not have to means they can do it, but do not have to. But they say that those under 2, absolutely not. And even WHO goes even on to say that those between 5 to 12 years, if we think they can abide by it. But we know that as large studies showed that children within 10 years to 19 years, they were able to spread the virus so much. So it's important that even those ages, they wear the face mask. So yes, the face mask is protective, but double face mask, no, I do not recommend it in children.
Okay, and children being from.
But again, sorry, let me just add that. So let me just say that in medicine, never say never, because initially, even when the pandemic started, masks were not important, isn't it? And so currently, yes. So let me modify and say currently, I do not. But who knows what is going to happen?
Thank you for the caveat.
Yeah.
Wonderful. Okay.
Maybe just a small comment there.
Yes, Doc.
Yeah, Jocelyn, I think that was a brilliant presentation. I just wanted to add that the use of the double had to do with probably the places that the individuals are working, and some areas where there's a high likelihood, people working with patients, people working in very enclosed areas, that those are the places that you see people doing the double, but certainly not in children, because we don't think they are in such a high risk area. So
absolutely,
there is a place for that in certain places where the likelihood is very high, but not in children and not in places where you are outside and there's so much air blowing and all that. It is not very likely that you will need to do that.
Sure.
Okay, wonderful. So I believe we can go on to our next speaker. So I'd like to say a big thank you to Dr. Dami, Dr. Jocelyn Dami. Thank you very much for your well-informed talk. I trust that maybe we'll call on you another time to help us in informing us about children and associated things. So thank you very much. If there was a way of clapping, we would all
Thank you too. Thank you for having me. All right. Take care. God bless.
God bless. Okay, so right now we'll be moving on to our next speaker, and I think our next speaker is known very well to most of us or all of us. She's going to talk to us about stigmatization. Doc, did I get it right? I believe so.
Yes. I hope you can hear me though.
Okay, so we're going to talk about stigmatization. And hello, is everybody there? Can you hear
yes,
me?
but you have disabled screen sharing, so I don't know if you will share the screen. I sent my slides, or I'm sharing.
Oh no, we'll make you make it possible for you to share your screen within a few seconds. Yes, the team will connect you. So that's Dr. Ama Isel, or Dr. Ama Kweku, community health physician and specialist, and consults for various multilateral organizations, and has worked in over 7 countries in the sub-region and beyond. So she's going to give us some well-informed talk this evening. Let's all be all ears, and if you have any questions, you can send your questions to the chat messaging area, or when it gets to the time, you raise your hands. Okay, Doc, have you been given the...
Yes, can you hear me?
Okay.
And
yes,
can
so
you see my screen? Can you see the screen, please?
Just a moment. Yes, I can.
Okay.
Okay,
thank
so
you
we are
Yes,
very
we
all
much,
can
clear.
see the
Reverend
screen.
Nana, and thank you. Okay, so this is going to be really a short presentation, and thank you, Dr. Odami, for the brilliant presentation. And I think that gives a very good background for me to follow up with the discussion. So whilst the pandemic of COVID-19 has been brewing globally, we realize that in pockets, depending on where you find yourself, another form of little pockets of epidemics is also brewing, which is stigmatization. And I will not even attempt to define stigmatization. I like to look at things practically. So these are slides I took off from a project we did with health essentials and water aid. And it's just trying to bring our minds to the fact that whilst we are managing COVID-19, whilst we are living with people who may have COVID-19, etc., there's something that should also come foremost to our minds, the issue of stigmatization. And this is just stimulating our minds to start thinking that we need to say no to stigmatization and only focus on managing COVID-19 as a team, as a church together, as clinicians, public health practitioners together. So say no to stigmatization. That is what we're trying to do. So this picture, I don't know what brings stimulates in your mind, but you can see some people standing behind a young boy who is passing by. You can think about different things, but I think the key thing that at least pops to my mind looking at this picture is the issue of maybe racism. They are seeing this black guy going past and they are saying all kinds of things. You can see them smiling to themselves or maybe even laughing. We can hear them, so we can really see smiling. And this boy looks sad. He's going by himself alone. And you can just think of the kind of emotions and the thoughts going through his mind. We go on to this picture. You see this number of people looking, we can't see the person they are looking at, but they are looking at somebody, some with very stern faces, as if, what is it? What is happening, etc. I mean, I wonder if you put yourself in the person's shoes that they are looking at, I wonder how you feel. Some of them with the hate, with the surprise and, hey, what is happening, etc. This is the marketplace, and probably I have more pictures of market because the intervention was really targeted at market women and truck drivers, etc. But I think it's also relevant to us as a church and generally wherever you find yourself. So this is the market. You realize that some women are looking on as this other woman, just laughing. You can see that her words have not been touched. Probably nobody is touching her stuff. And everybody is kind of isolating themselves from her and they are just laughing at her. I'm just trying to build a picture in your mind with these pictures. Now, we just finished talking about children. So imagine your child who has gone to school and you have other colleagues standing, gossiping about her, saying things, and she's alone, nobody is getting close to her, the kind of emotions that goes through the kid, the kind of emotions, the thoughts that goes through her mind, and how does she even cope with the situation. And even very little kids, you see this little boy at the back is trying to catch up with these two who are running away laughing. They don't want him to catch up. What is the issue? There's something that they are trying to run away from. And I wonder what the little boy who's trying to catch up with his friends will think. Why is he being isolated? How does he cope with that? And even the more extreme form of what I'm talking about, some people can get so traumatized with what is happening to somebody else that they can even turn violent and hurt people. So you see this very angry woman about to slap somebody who they think that shouldn't be in their space, etc. Again, a little child who is alone by herself, people pointing fingers at her, look at her, what can they be saying about this little child? So, and then I think this is the final picture. This woman trying to come close to her colleagues in the market, and then she actually being pushed away. What is the story? The story is that some or any of these people could be a COVID-19 survivor, somebody who actually got the infection but has recovered. How do they come back into the society? How are they accepted? That is the issue of stigmatization that we're trying to talk about. Why should they have to go through this? And this is one of the slogans we came up with. I am not a virus, I'm like you, because anybody who develops COVID-19 could have been you, really. It's just the same person that we have known. If it's, I'm going to tend to the chest setting, and just happen to have the infection, yes, we may go through all the preventive measures Dr. Odami and the people from yesterday talked about, doctors from yesterday talked about, but yes, some people still have COVID, and they do recover when they go through the treatment, and they have to come back into society, into their workplace, into church, into their homes, etc. And we must prepare to know how we relate with them. How do we relate with them? I think that people why do we even stigmatize people? And I believe that you have had an impression about what stigmatization is all about. Being pointed out, being isolated, being left such that you have to deal with a situation by yourself. I think people do this because they are afraid of what they unknown. And it's important to have these kind of discussions we are having here. Because when you entertain or have the right facts, then you will not be afraid. If you've been told that, yes, if somebody has COVID-19 and is treated and recovers, the person comes back to themselves. That doesn't mean they will never get it again. By that point, I think they are the safest people to be around, in my opinion, because you know that they have had it. And the least you can do is to continue preventive measures like we have been told. If you know the facts, the thing that you go on doing is to wear your mask and do the hand washing that we have just been told of, clean your surfaces, etc., etc. So let us fight the virus, not ourselves. And maybe for some people listening now, it sounds strange to you, but these are real issues that are going on, because we had the opportunity to talk to a lot of COVID-19 survivors who are going through severe challenge at the verge of committing suicide because they cannot infiltrate or get back into their normal workspaces, etc., because of the issue of stigmatization, they being isolated and called out. And the question is, must we shatter the stigma of people's feelings? I think all the efforts we have to be projected or focus on rather shattering the stigmatization, putting our energy in hurting people's feelings. We should focus on the most crucial things that we must do and love others. If you love yourself and you love others, you will not be tempted to isolate or stigmatize somebody or point somebody out or laugh at somebody, because you know that it can also happen to you, and these things should be at the forefront. But as we hear about, so now you have people who actually get the disease and they don't even want anybody to hear that they did have it at any point in their life. Meanwhile, the truth is that we should rather come out and encourage people that I got it, I survived, so you survive even if you get the disease. But because of this issue, people are hiding, people do not want anybody to hear about it. But that is what we need, rather, to let people hear about it. The question is that when they tell you, will you stand with them and agree with them and ensure that we can all survive COVID-19 together? it could have been you who got the COVID-19, and you should be grateful to God that it wasn't you. So it is not time to push away somebody you heard that, oh, this person got COVID-19. Just, you know, and when you see them, you are just trying to stay away. You are telling others about it, stay away from the person. You are telling your kids to stay away from the person, although it was an auntie or an uncle who used to even spoil them after church, etc. That's not the way that we should deal with this disease. It's rather to bring them together, to bring to comfort them and to find social protection and things for them, support them as a church family. So after showing all these pictures, it's just a summary of the key things I want us to remember. What is the stigma? What is the impact on us? People feel for the person who is at the point of being stigmatized. They feel isolated. It destroys their self-esteem, and the impact takes a long time to recover from. So we had some people, and I will just talk about one person that met, a market woman who had actually, at the beginning of COVID-19, when the whole thing, the pandemic started in Ghana and they started doing the contact tracing, etc., she was picked up from her market place where she sells, because I think she was a contact that had been traced. So the van picked her up. She was actually a market queen. And then they went and even she didn't even have she didn't actually even have the disease. She was isolated. No, she was quarantined for the 2 weeks. And when she came, the whole market shut her out of the place. They wouldn't let her enter, or she lost all her wares. They became rotten. Her money went down the drain for months. She just couldn't go. And even when she forced herself to go and sit down, everybody left the vicinity. When we met this woman, she was almost at the point of suicide, because she said if she can't sell and she can't come and get money to go look after her family, she's better dead. And there are lots of people. Another young man we met also recovered from COVID-19. Actually, a Christian, went out with his colleagues. They were sitting eating, and he just started pushing the subject. You know, I just recovered from COVID-19. Well, he was eager to share and give a testimony of how God had actually helped him. And lo and behold, he said literally within 5 minutes, or even less, everybody made an excuse and left him sitting all by himself. So how do you think this young man is going to cope? And how do you think the person is feeling right now? He swore never to tell anybody ever that he got COVID-19, ever. So we went in as doctors and we started chatting with him and encouraging him. So I'm sure the second, the presentation after me is going to talk about the psyche of the COVID-19 patients. And I'm sure all these psychological challenges will be raised there. So why the stigma? As I said earlier, people are afraid because of the unknown. They don't know, they are misinformed about how they should act around COVID-19 survivors. And for some people, you know, there are some people who are just deliberate troublemakers. It's out of habit. They will do it whether, even if they knew the fact. That some people, look at the lady who was ready to slap somebody. You can see she's kind of a vicious person already. Why would you be slapping somebody if the person has COVID-19, has recovered and is coming back to work? So how can we change the stigma issue? It's important that we do things like this at church and frequently, get more people to get involved and listen, because the more you get the information, or the more you get reliable and accurate information on the subject, it leads to changing your thoughts about the fear, or it's leads to your fears, and you're better able to engage and become a change agent and support people. So who is the change agent? I think I'll talk about the change agents at the end of, or later on in the discussion. What can we do to make our churches or localities stigma free? As I said earlier, enhance education on stigma. we can set up different groups. Even if we can't have these health weeks or health discussions often, there can be small groups that we can use to discuss these issues. And I think we talk about prevention, control, but the issue of stigma should be brought, especially as for me, I see the church as a place where we should rather give support as a family to the people who have recovered, encourage them. I'm sure there are a few, maybe church elders, etc., who are doing that. But then I think this knowledge should be made known to all the people, so that, I mean, yes, the church elders will probably visit you, talk with you, pray with you, but when you come back to church or you go back to the workplace, you also have to mingle with other people. The question is how will they treat you? And we should not just make it a one-time thing. I'm just going to re-emphasize that frequent updates on this subject is necessary to be able to stop the whole thing of the stigma issue. And also, I think one of the things that we need to do as a church is to look at how can we set up systems where we rapidly assess how is the issue of stigma going on in church? Is there something that we can do? Is this going up? Is it decreasing? Is it even out of the system? And as we assess quickly how the stigma issue is, we can develop interventions to quickly just make sure that it's stamped out from the church altogether. Overcoming fear using safety protocols and authentic information is very important. We need to emphasize, if we emphasize the adherence to safety protocols that we've already been talking about, it will go a long way to even control the stigma issues, because people will understand that when I use this thing, whether the person has had COVID-19 before or not, I'm still protected, irrespective of who the person is. It's the fact that I think the people, we should even be more worried about the people we do not know their status about COVID-19, and that should be emphasized everywhere we speak about the issue of stigmatization. And then important, as I said, to educate on the facts of the virus and how it spreads. And I think Dr. Dami and people and doctors from yesterday have done that. And we need to continue to do that to build people's confidence in what they are doing, how they are preventing, how comfortable they'll be in socializing with a person who's had COVID-19 already. And then we need to probably find a space where we can discuss some of the myths around COVID-19. I think this is a kind of space, I'm sure it's been said in maybe earlier on. I was not able to join yesterday. I was in a place where I had no internet connectivity. And if we dispel the myths, then people will be more comfortable, and all the misinformation will be taken away. We should also know that stigma is a human rights issue. So people who have recovered from COVID-19 also have rights that are being violated because of stigma and discrimination. And we need to remind our colleagues at work, remind people at church that it's a human, they don't have to be stigmatized because they've had an infection. Well, what are human rights issues? There are basic things that we all should have as human beings. Like you have a right to be in any space, you have a right to be in your workplace and work. If you had COVID-19, you've protected yourself, treated yourself, and you've been declared well, you have every right to come back to work, and you shouldn't be discriminated against. And we need to remind people that they need to treat people fairly, irrespective of whether they are COVID-19 positive or negative or they've recovered. Everybody should be treated equally. The most important thing is to have the right information to prevent yourself from contracting the infection. So we have all kinds of protocols that we discuss that we need to follow as to prevent ourselves from getting COVID-19, protocols to even adhere to when you actually have the disease and you have to, or the infection and you have to be treated, etc. But we must remember that if somebody is being stigmatized and is sad, is depressed, etc., those protocols can't work. perfectly, because people, first of all, will hide the fact that they have the infection. They will not even let you know in the first place, and they may not, especially those who are not very severely ill, they will hide. And I know people who have done that because I've interviewed them. They just mingle with everybody. They refuse to go to the health facility to see a doctor. They refuse to not go to work. They refuse not to go to church. They will just come in, and because they do not want anybody to have an inkling or anything that they had any issue, so that they'll be stigmatized. So then if we do not stamp out stigmatization, we even run the risk of these protocols actually not working. Because if I'm not sick to the point that I'm going to fall down, I'm just going to push it and just come in, especially if I'm not coughing loudly and I have just the mild form of the disease. Then I become a carrier or an agent in the midst of everybody. If I was comfortable, I was sure that I would not be discriminated against, I would quickly go to the health facility and start the treatment. So we also have to be mindful that the stigmatization is not just going to lead to the person emotional challenges or mental challenges or psychological challenges. There are real facts too. If people feel that they are being stigmatized, or for example, this market lady who couldn't go back to her place of work for months on end, so we went there to actually train and teach the people. And even now, it's not so 100% that she's comfortable there. The fact is that people will lose their livelihood. She needed to make money, but then because of all these issues, she could actually not make money. And the issue of poverty leading to, if you don't have money, especially depending on where, in Accra, it's already, I've been traveling through the north this past week, still somewhere there. And if you see the poverty, the abject poverty, you don't want to even increase the person's situation. And even in Accra, I mean, there are lots of people who, and even no matter where you work, if you are not able to go to work for months, you are going to start going towards the poverty line, maybe not immediately, but systematically, you're going to lose your income, and that's going to have all kinds of implications on your family, on your children, if you have little children, even older people, malnutrition, etc. We need to avoid and prevent avoiding or letting people who have recovered from COVID-19, preventing them from coming into common places like church, even after recovery, leads to isolation and a lot of mental challenges. As I said, some people are even suicidal. But this, for me, this slide is the most important thing. And I think it's my last slide, if not one of the last. No, it's not my last slide. But it is important that we leave this meeting. For my session, if you remember nothing at all, I just want you to remember that be the change agent for challenging stigmatization. You can do it in different ways. You can be assertive and speak out against stigmatization. This applies to people, even if you yourself have contracted or had COVID-19 infection before, you should not shy away from even being able to be assertive, talking about it, and teaching people that you rather have to accept people back into the society, so that people do not end up breaking protocols, and that there's nothing, you need to share information. You can be a change agent at work, at church, at wherever you find yourself, any field. You can just even decide to set up little groups in your community, in your household of faith. Just make it as practical as possible. But even if you spend 1 minute or two minutes in a week talking about it, I believe that if we all put our voices together, we'll stamp out stigmatization before it even starts. This is real, because diseases like HIV and TB started with huge stigma issues. We all remember when even we didn't even want to sit in the same room with an HIV patient, but it's all because of fear, misinformation, as I have said. But now that we understand more, now that we see that, I mean, we can sit and eat with HIV people and we are going to be infected. People are more comfortable. There are amongst us. They are living happily. And I think that we need to prevent the stigma being associated with COVID-19 even before it starts. So some of the messages that we developed for the market women, I think it applies also to everybody, depending on where you come. But when you get this COVID-19, family care and support is needed. So this is not the time that the family shies away from you, whether it's the nuclear family, whether it's the extended family, and especially if it's the church family. Family care and support is needed during and after recovery from COVID-19. And this woman is actually a change agent because she did get COVID-19 and she's speaking up so that she stamps out stigma. And she says that my family was there for me. And so be there for your family members who have been infected. This is the same woman showing us that she and her baby are healthy. And this should tell you that COVID-19 can be beaten. And I think it should be rather a message of encouragement instead of a message of shying away from them. So this is, I will probably not tell you, being infected with COVID-19 is not the end of life. I'm healthy and back to learning my tailoring profession. You can also do the same. So this is a message of encouragement. One, yes, try to prevent COVID-19, but even if you do get it, this agent is telling you that, yes, you can still recover, get healthy, and do everything that you need to do. And this is just reminding us again that if we do not prevent stigmatization, this man says that living in a room with he's an agent, but he preferred not to show his face because of this issue. Living in a room with no roof is not different from being stigmatized. There's no protection, anything can harm you. So that is how a person that is going through the stigma issue feels. They feel so unprotected. They feel that anything can happen to you, anybody can hurt you, anything can happen to you. So my last message is, let us continue with the protocols at all critical times. We should be part, these protocols, mask wearing, hand washing, etc., should be part of our daily life. Thank you, and I will stop here.
Wonderful. Thank you so very much, Dr. Amma. So I believe if you have questions, as we said in the beginning, you can raise your hand or you can send your question to the chat messaging area and it will be picked up immediately. So anyone with a question? I don't want to be the first to ask a question this time around. But if you've got me, I will.
You should be the first.
I should be the first. Okay. Okay, well, I just want to ask your opinion. Shouldn't we know that there's stigmatization out there? So shouldn't we be informing people that this is what they could face? So strengthen yourself for what is ahead, and then also add the other bits. Hello, Dr. Amma. Hello, Dr. Amma. Okay, well, anyone can answer while we wait for Dr. Amma's reply. So is there anyone who can speak to the issue? We all know that there's stigmatization out there. So what should we be telling the person who has just come out of the COVID, maybe isolation, or has recovered from COVID? What should we be telling the person? Shouldn't we get the person informed that this is what you are likely to face out there as a first step?
Okay, so I think that,
let me just
yes.
say something.
Okay, so let Dr. Amma, you go first, then Dr. Popo come.
Sure.
Hello, can you hear me now?
We can hear you, but I think Dr. Popo
Hello?
speaking, and we can't.
Okay, let Dr. Pope speak. It's fine.
Okay, so he's off now. So kindly go on. Then Dr. Pope will come in.
Okay, so I think, yes, I do agree that I think this message should be shared with them, and I believe and I hope that it's being shared, because I think they receive some form of counseling before they leave the facilities, but maybe it doesn't fully also prepare them for what actually faces. Yeah, one thing, can you hear me?
Yes, we can hear you.
Hearing something and actually going through it's physically is something else. So
yes,
as the doctors try to cancel or as the health professionals try to cancel when they are being discharged, I think the community also has to play a role by stamping out the issue of stigmatization. So I think it's a two-pronged approach. That's Dr. Pope.
Okay. Thank you, Dr. Pope. We're listening to you as well.
Yeah, Amma, that was a very excellent rendition of the topic. But
Doc,
I think
it seems like you have to
when it comes to okay, so is it better now?
Yes.
Yeah, when it comes to when it comes to stigmatization, the individual, just like Amma said, would have to be spoken to, as well as the people that he's going to be with. Of course, the people that she's going to be with, we might not be able to talk to all of them because you don't know the various peers or groups that that person belongs to, at least the immediate family. And the person must be counted. Usually before they leave the center, the psychologist picks them up and tells them about all these issues before they go. And so with this, armed with this kind of education, and there are some things that they can do. There are others that it's not within their control. If you go to an office where the people you are working with have never, been told anything, and the people who stigmatize do that out of ignorance. Most people, do that, and so you notice that it is rife in communities with very little information about what is going on. And so, if possible, the various places that the individual is going to find him or herself, if
Hello, Doc. Hello, Doc. Okay, I think Dr. Pope's line has gone off. So in the meanwhile, there's a hand up, and I'm looking for that. Paulina. Yes, Paulina, kindly go ahead while we wait for Dr. Pope to come back.
Okay, good evening, everyone. I would like to know, is there any, stigmatization, is it a criminal offense? Or if I'm being stigmatized, can I press charge? Or how do I defend myself if I'm being stigmatized and it's affecting me? What do I do? Can I press charges, or is there any criminal?
Okay, all right. So,
any legal backing?
Okay, so Doc, the question is there a way to legally defend yourself, or is it a legal, is it an offense for somebody to stigmatize you? Hello, Dr. Amansa, or anyone.
Unfortunately, stigmatization, depending on the form, it's, as I said, it comes from this mouth, there's making fun of people, to maybe the severe form or the extreme form where somebody will come and slap you or something like that. If it is not if the person has not done something that is actually illegal, like slapping you or hurting you or something, unfortunately, it is not a criminal offense that you can go to the court. I'm not a legal person, but what I've known over the years from stigmatization for HIV, TB, etc., there's nothing like I took somebody to court for lying. So no, unfortunately, that is the difficult, and that's why we use education to try and combat or try to reduce the impact, or even try to stop it from happening. So unless the person has hurt you or done the things that actually we all know is illegal, no, it's not illegal. Like.
Hello. Okay, so thank you very much for that answer. But Doc, if what do you call it? The COVID situation is a very serious issue.
I'm hardly here now, I think.
Hello, Doc.
Hello.
Yeah.
Yes, I'm listening.
So I'm saying that if COVID is a very, it's a serious, quite a serious thing that is happening now, and it's driving people to, the effect of the stigmatization is driving people to suicide and things like that. Shouldn't it be treated more seriously by the authorities?
Well, stigmatization is not a new thing to the medical practice or to diseases. As I said, a lot. If you remember when we were younger, TB, people will not even go near. HIV, the same thing, but we never have put in place any laws or policies that leads to people being taken to court or being sent to prison or anything like that. We've always had health practitioners develop targeted messaging and what you call social behavioral communication strategies to educate people, because the main, as I said, the root cause of this whole thing is fear. So will you compound the issue? Now the people are afraid they are behaving that way because they want to protect themselves. Then you catch them and take them to prison. That is like double-edged sword. So if you want to rather manage and control the issue, you hit it at the root cause, where you let the people understand, get the right information over and over. Behavior change takes a little bit of time because they have to hear and see the results. And after a time, they change. Like now, as I said, HIV stigma is not so, it's not a big thing anymore. So I think it has not been a practice to punish people in that way.
Okay.
Because the root cause is here.
Okay, so I'll ask another question. This is not necessarily medical. While we wait for any other question before we go on to our next speaker, is there funding for anybody who says that, okay, I want to take on stigmatization, I want to form a group, company, whatever, and there'll be funding for anything like that? Yep.
Well, all kinds of funds are going on there. A lot of COVID-19 funds. As I said, we are doing this work with Water Aid. So they got money to do stigmatization, but the money was really just for training and getting messages and jingles, which we probably have started hearing on TV and TV programs, etc. They haven't gotten money for now for group work. We have peer groups and things which are funded by some agents. But I'm sure if you are interested, you definitely find. These days, if you can write a good proposal and link up the COVID-19 issues, you definitely get some money and show evidence that you are
because
knowledgeable
we are saying,
about what you are going to
do. Okay, so we are saying that
if you are interested, we can talk.
Okay, yes.
No,
definitely. I'm sure there'll be people who are interested. The reason why I'm saying is that we are saying the church should get interested in some of these things and do something. But probably this is how the church can go deeper, because most of what we do as a church may be in church, but we want to be out there. So I would like to say an appeal. Those who know where the funding is, why don't you, or you know, get info, you have information about some of these things, let's make it known to our church people and let's see what will come out of it. So we brighten the corners where we are.
That's a good one. So we'll think about it together.
Wonderful. Yes, please, any questions? Any other questions, please? Okay.
I think I saw Paulina's hand up.
Sorry, Doc, we didn't hear that.
He saw Paulina's hand up.
No, Paulina asked a question when you went off.
Oh, okay.
Dr. Pope, you were saying something before you went off. Maybe you can finish it up.
Okay, yeah. So I was just trying to point to the fact that there's an extent to which one could fight this, and it could be on different levels. In the case of the individual, yes, that person plus the immediate family, fine. Then maybe before the person is start, if some knowledge is known about where the person is likely to continue, the places that the person work or interact with people, then those areas could also be tackled. But then this becomes a big task because everybody has his own sphere. And so as much as possible, the greater chunk of the lessons must go to the individual so that he doesn't get depressed when people are reacting, and rather understand it in a different way so that he or she can go about his duties without having to make the reactions of people affect him. That's what I wanted to say.
Yeah, I agree with you totally. Any contributions from all our... Okay, so I think we'd like to say a very big thank you to Dr. Amma for giving us deep insights into the issue of stigmatization. And thank you for all your answers that you have given. And do not forget about the funding sources and so on. Our next speaker, by the name of Reverend Asari Bediakun, who's a pastor in charge of Harvest Chapel International, Atlanta. He is a licensed professional counselor and a certified professional counselor supervisor. And by the grace of God, he has his own practice in America, in Atlanta, I believe, where there's Holistic Solutions. The name is Holistic Solutions Counseling Services. And he also works for the City of Atlanta Psychological Services. He has years of experience in conducting psychological evaluations at various emergency rooms and hospitals across the state of Georgia. So the years of experience in providing psychotherapy and counseling services, and also a first responder for traumatic and critical incidents, providing debriefing. And you'll be surprised at the many instances where he's called out to go and offer traumatic help. Okay, so in addition to that, there's a glorious statement. He's married to his wife for 20 years. And next month, that's in the next month, I believe in June, there will be 20 years in marriage. And he has 3 teenage children. So we would like to welcome Reverend Dr. Asari Bediakun. Shall we all welcome him?
Thank you very much, Reverend Anna. I don't know if you see my face. I'm not doing a slideshow, so I don't know if my face is seen or not. Okay. Can you hear me?
We can hear you very well.
Yes, we can hear you.
Okay. So thank you very much. So I am going to talk shortly about some of the you say psyche, but I want to call it mental health. You know, some of the mental health of both COVID patients and society at large. You know, COVID has brought a certain knowledge or a certain kind of challenge that is unique in that typically when people are sick or when people are not feeling well, when people are sorrowful, when people are grieving, you know, one of the things that usually make people feel better is human contact. So even for folks who are sick, you realize that when people visit them, when family is close by and all that, they recover rather quickly as opposed to folks who have no family contact. But COVID-19, the nature of the disease is such that when somebody is suffering from COVID or somebody in the immediate family is dealing with COVID, instead of family gathering around to provide support, we are rather encouraged to isolate. And the isolation alone is a whole big deal when it comes to mental health, because people need support, people need encouragement, people want to know that they have the backing of everybody. And so some of the very things that we are pushing to stop the spread of the disease is actually making it worse for people when it comes to their mental health. So COVID-19, in terms of our mental health, you know, has two kinds of effect on us, or it comes out in two ways. The first one has to do with anxiety, and the second one has to do with worry. Now, when people are anxious or people are worried, they behave in a certain way, right? So first of all, let me give an example of worry. Somebody may be worried. Why are they worried? They are worried because they are in an environment where somebody was exposed to COVID, or because their spouse or a partner or their child or somebody they know had COVID. They are worried because they don't know whether or not they are going to be exposed. They are worried because should they be exposed, how are they going to handle it? And even for a person who has the COVID, right, there is also the worry. What is that worry? The worry is that I've seen people had this COVID. Everybody reacts to it differently. Some people live through it with no symptoms. Some people have very extreme symptoms. Some people are admitted to the hospital where they can't breathe and all that and have to be put on oxygen. And some people actually die. And when you watch TV and other things on social media, you get to see all these many people who are dying from COVID-19. So when they tell you that you are positive for COVID, a whole lot of things runs through a person's mind. And so that worry, and then in addition to worrying, there is not the opportunity to do anything about the situation because there is practically almost nothing you can do about the situation. So it puts you in that place of apathy or helplessness where you can't really do much, but just waiting to see what will happen in your situation. And that puts people in a place of depression. So the worry that comes with COVID-19 actually pushes people to be depressed. And usually when people are depressed, you get to see some symptoms. I'll be speaking about some of the symptoms of depressed people shortly. But when people are depressed, you begin to see some of these symptoms. And when it gets to a place where people think that they can't handle it any longer. It pushes people to commit suicide. So, and all kinds of things. So even during this COVID period, you realize that suicide rate has really, really gone up through the roof, especially for people in so-called advanced countries. We thank God for Ghana that it wasn't that bad in Ghana, but in advanced countries, you realize that the level of suicidality has really shot up through the roof. And that is practically because of all the worry that people feel with the pressure of COVID. Then you also talk about anxiety, right? There is this fear, this disease. We know COVID has been around for a long time, but COVID-19 is a different kind of strain, right? And this is a strain that the medical experts don't know much about it. World Health Organization doesn't know much about it. And then even the guidelines for how to deal with COVID keep on changing, right? And so that makes it very uncertain. You really can't pinpoint. Today, mask works. Tomorrow, they say maybe you don't need to wear the mask. They say you need to cover your eyes. You don't need to cover your eyes. You need to do this, because even the medical experts are trying to figure out, right? And then in addition to it, we don't really have any medication, that will actually heal somebody who has COVID. There are trials and errors with chloroquine and all kinds of medications that are out there, but there is nothing that is specific that says that, hey, this is the pill you take for COVID. So when you get COVID, there is that fear. Am I going to live? Am I going to die? What is going to happen to me? And it creates a whole lot of anxiety. And that anxiety pushes people to places where some folks begin to have panic attacks. And I'll be giving examples of some of people I've had to deal with in my practice and even in the city as a whole. People begin to experience panic attacks. OCD is up. Why is OCD up? I remember not too long ago, I went to a phone shop. I wanted to add some features to my phone, and I was looking at the young lady that was helping me, and all I could do was to say in my head, oh my God, because I was there for about 30 minutes. And in that 30 minutes, that lady applied the hand sanitizer to her hand over 45 times. That is OCD. That is a washer. And this happened because the fear of COVID is driving people to extremes. I have met people who, actually one of my colleagues who is a physician, got very bad COVID and he almost passed away. And after he recovered, he didn't want to go to the emergency room again. His job, he's a doctor, he doesn't want to show up for work, because even though, and he has all this knowledge, about, hey, the likelihood of me getting COVID is just about 5%, but that was enough to scare him because he came close to death. I have another co-worker who was telling me that when I got COVID, at some point I thought I wasn't going to come back. So I actually called and made funeral arrangements for myself. Now, when you hear people say things like, I was making funeral arrangement for myself because I have one son, he's 22, and I knew he couldn't handle it, that puts you in a place of understanding that the fear that comes with COVID-19 can be as strong as the fear of death, right? So that fear that is as strong as the fear of death causes people to react in certain ways. So the stress reactions and the worry reactions are both present when you talk about COVID, right? A couple of months ago, right down here in Atlanta, a certain young boy, about a 19-year-old young boy, was going out to town, and his parents were like, no, don't go, there is COVID, and he didn't listen. He still went out. The young people are sometimes disobedient, especially in this part of the world. And then he came back after a couple of hours. It was night, and he wanted to come in, and his dad wouldn't let him in the house because he was afraid. Who did you get in contact with? Are you going to bring COVID to us in this house? And being silly, he kicked the door open, and his dad shot him in the chest and killed him. And It was like, wow, it was that bad that he had to shoot and kill his own son over COVID-19 that you don't even know whether he contacted or not. So that tells you that when it comes to COVID-19, the amount of anxiety that is creating so much fear and so much worry causes people to begin to react irrationally. All over America, we thank God for Ghana, where people don't walk around carrying guns. All over America, how many times were people not shot at the stores and at the malls and all kinds of places simply because of fear? Somebody is told, put on your mask, and then it turns into a gun and a bullet issue. So this fear and this anxiety is actually pushing people to do all kinds of things, including things that they shouldn't do. So what are some of the common things that you see with people who are experiencing COVID-19, or people who have experienced COVID-19, or people who are close to others who have experienced COVID-19? How does this affect our mental health? I said that there is the worry that leads to depression, and there is also the anxiety, which is created by the fear of the disease, fear of whether I will live or not, fear of who is in my environment. In fact, not too long ago, Dr. Amma was talking about stigmatization. Stigmatization is simply due to fear. People are afraid. Hey, we don't know about the nature of the disease. We don't know whether you can still infect us with the disease or not, and all kinds of things. So there is that pushback, and that leads to isolation. Isolation leads to rejection. Rejection puts people in a very bad place where they either want to die or not live any longer, or to retaliate on people and all kinds of things. So mentally, COVID-19 has all kinds of effect on us, depending on who it is and how it is being looked at, especially even with our older people, who are more vulnerable. They are scared. Since COVID started, here in America, there are people who have not set foot in church or in any public place because they are afraid. Now, there is something that fear does to your brain, right? When people do something that is bad and not accepted in society, one of the ways we deal with them is to isolate them. How do we isolate them? We isolate them by sending them to jail or to prison. Prison is a form of isolation. It prevents you from having regular human contact. It prevents you from having your regular social support network around you to give you the support and encouragement that you need. Guess what? COVID-19 has brought us to a place where a lot of people, even though physically they are not locked up, still feel like they are in prison, because especially in a lot of advanced countries where there is the lockdown, where you can't leave your house, or you have very limited ability to leave your house. Even the mask is an infringement upon your liberty to breathe well. Your mask hinders your ability to express your smile or your emotions to somebody. So even some of the protocols of COVID-19 makes people feel imprisoned, right? That feeling of imprisonment causes the mind. Our mind is funny. It reacts in a certain way. When you go to jails, when you go to prisons, people in that environment have a certain kind of mindset, and COVID-19 has brought about that mindset in society at large, and especially among households that have had the unfortunate incidents of somebody being infected with COVID-19. What are some of the common psychological things that you see with COVID patients and others who are dealing with COVID patients? There is that feeling of fear that I spoke about, right? And then there is also that sadness. Am I going to make it? Am I not going to make it? There is the worry. There is the numbness. Folks are apathetic. They become numb. And then there is also the frustration that is present. Then with depression, usually when people are depressed, you see things like changes in appetite. Some people have very bad appetite, they can't eat well, there is changes in their desire to engage or do things that they usually enjoy doing. And these are some of the things that we see with those who are especially depressed, you know. And then there's also the difficulty concentrating, you know, because the mind is running 100 miles an hour, wondering about a million things. Like I said, somebody was planning her funeral, you know. That means that you can't concentrate, you can't focus on anything, you know, and difficulty in making decisions. Sometimes you can't think ahead, as somebody said, I can't think far because I don't know what tomorrow holds. So it brings a lot of physical limitation right in our face, and that is not a comfortable place to be. In addition to that, people have difficulty sleeping, especially people who have recovered from COVID, and especially those who had to go on admission and were put on ventilators and saw others die. There is this trick that our brain plays on us that, hey, it's possible that when I sleep, I may die in my sleep. So you have folks who have had COVID and they come back and they are trying not to sleep too much, even though they are recovered, because they are afraid that what if I sleep and I don't wake up again? Not too long ago, somebody was assessed at the emergency room, and this person had no prior history of mental illness, has never been diagnosed with anything, and this person showed up with psychosis, you know. And then this was somebody who had actually recovered from COVID, and everybody was like, this looks like a different symptom. Does it mean that there's COVID-induced psychosis? But actually, it wasn't a COVID-induced psychosis. This person had gone without sleep for so long, you know, out of fear that I can die in my sleep. And so the brain had reached the place where they were now hallucinating. So COVID has all these kinds of effect on people, you know, so difficulty sleeping, and then some folks have nightmares and night tremors, and none of these things are pleasant. Then you also have people who experience some psychosomatic symptoms. These are symptoms that are not actually biological in nature, but the stress that and the worry and the anxiety that people are going through brings to them. You know, so you have people who begin to experience this chronic headache, you know, from nowhere. Their head aches and aches and aches, and they are wondering, is it because I recovered from COVID that my head is aching? Is this a side effect of the headache? I remember not too long ago, maybe it's about a year now, the mayor of Atlanta, the husband got COVID. Actually, both of them got COVID and they recovered. And then a couple of weeks or months after, the husband continued to complain about this serious migraines that he was having. And I immediately heard it. I said, okay, I know this is a psychosomatic, because there is nothing that should cause the migraine other than the fear and the extreme anxiety that he went through producing this headache. So you have some of these things happening in body ache, stomach ache, and for some people, even it can manifest in physical ways as skin rashes and all kinds of things, you know. And then you have people who, because of the fear and the worry, remember that every time you are under extreme fear and extreme worry, it affects your immune system. And so because of that, they begin to experience all kinds of chronic health problems. They begin to experience all kinds of health challenges because of the extreme worry and extreme stress that they are dealing with. So you have all these things happening, and they are happening simply because in people's mind there is that uncertainty. We don't know. We don't understand. We have no idea what is going on. Families can't get close. Just imagine when you are sick and you're admitted in the hospital, you don't know whether you will live or die. And your wife or your husband or your children or whoever your close family is prevented from seeing you. Even in your head, there is that worry. So was the last time I saw my partner going to be the last time ever? I was going to see them. Will I live through this? Will I die? And all that. So all that produces all this agony in people. Now, when people are agonizing, they behave in all kinds of ways. Some are acceptable, some are unacceptable, but all of it is realistic to the person who is actually experiencing it. I'm working with people who don't want to go back to work after experiencing COVID, because they caught COVID at work, and then they are at a place where they don't know whether they want to quit their job, they want to retire or whatever. They are not actually at retirement age, and yet they are afraid to go to work. That is going to have a whole lot of impact on you. I remember last week I spoke to a young man who hasn't set foot at his workplace in about 4 weeks now, and they were thinking of terminating him because he doesn't have leave of absence or anything. And so COVID-19 has this effect on our mental health, which actually affects all other areas of our life. And then also when you speak to people who have actually recovered from COVID, you hear them say a lot of times that, I don't feel like myself any longer. I don't feel like myself any longer. And sometimes you ask them, what is going on? And they can't pinpoint one particular thing, but all that they can tell you is that something is not right. Something is not right. I wish I could tell you. You have some people also, because of the trauma that they experience related to COVID, right? They experience some short-term memory, and this is an interesting thing that we began to realize over and over again. Typically, for instance, let's say somebody goes through a traumatic situation, a bad example, somebody gets robbed at gunpoint, or a woman is raped, or those traumatic things. It is common for a person to experience short-term memory loss. It's your brain's way of kind of blocking what happened to you, right? And then you have COVID patients also experiencing short-term memory loss. That tells you that it is really traumatic to people who experience it. Some people also experience confusion. They can't filter things through. And then there are a lot of people who also, after they have recovered, still have trouble concentrating because their mind keep on going back and back and back again to what they went through and all those things. And that can be really, really problematic, and then in addition, sometimes people may recover. I remember one person that I was speaking to, after he recovered, even 2 weeks after recovery, his sense of smell had not come back. And then he was telling me that my wife was cooking. I was sitting right there in the living room. My wife went upstairs. The food was burning, and I couldn't even smell the food burning. By the time she came back, the pot had turned black. And then his worry was, so should this have been a poisonous gas? Does it mean I wouldn't have been able to notice it and I would have died? So that worry is there, and it creates a whole lot of stress in people. Now, so the question is, how do you deal with this anxiety? How do you deal with this stress? Number one, I always tell people that stay away from all the social media that keeps on going, or that keeps circulating about COVID, and these people are dying here, and they can't find places to bury people, and people are being burnt here, and this and that, and this number of people died today, and this. When you keep on listening to those things, you always have a heightened sense of awareness of all the negativity that is going on, and listening to negative things has never, ever helped anybody. So always reduce the intake of information from social media platforms and news if it is possible. Reduce the number of things you do that has to do with information coming to you concerning COVID. Yes, get an education on how to protect yourself and all that, but don't focus on all the negative numbers and all the negative news and these people are dying here and this and that. That is not helpful. So doing that, number one, is helpful. Number two, we all need to learn how to relax. relax. There is a scripture that I like so much. Jesus said that which of you by worrying can change one hair on their head. There is nothing that your worrying can do for you. You can worry from morning to evening every single day, and that will not do anything for you. So instead of focusing on the worry, right, look at the positive things that are going on and meditate on those things. Focus on the positive things that are going on around you, the positive news. Like in America, now I hear positive news. Less people are dying, less people are contracting the disease, less people are getting infected. The numbers are going down. They are taking down the mask. That is positive things. Yes, people are still dying, but I don't focus on the negative part. So focus on the positive things. Make sure that you get enough sleep as well as enough rest. Some folks are not sleeping enough, especially after they contact COVID or if family members contact. Make sure you get enough sleep. Make sure you also exercise. Do things that take your mind away. And then it's also important to stay in contact with people. Yes, they say that let's isolate physically, but that does not mean that we have to isolate entirely in every single thing that we do. You can still speak to somebody over the phone. You can do a Zoom phone call. You can do a WhatsApp chat phone call. You can go to church online if you are in a place where church services are not open to public. And if it is open to public, then by all means, go to church in person, because that contact is helpful. One of the reasons why, especially during this COVID period, folks are advocating for children going back to school is that social contact. That social contact brings healing. It brings calmness to the mind. It calms a person down, and it's actually healthy. So we always encourage people that in as much as possible, if you can have social contact with social distancing, that is great. It's better than keeping to yourself and not having any social contact at all because you're afraid you're going to contact COVID-19. So social contact is really, really important. And then for that to happen, one of the things that I say is that if there is the opportunity for you to be vaccinated, get the vaccination, then that brings calmness to you, because we know that folks who are vaccinated are less likely to contact the disease. There is the 95% chance that you will not contact it. And even a 99% to 100% chance that even if you contact it, it will not kill you. So if this will reduce your anxiety and this is going to reduce your worry, then why not just take the shot? So if it is available, I always tell people, for the sake of your own mental health, just take the shot so that it will calm you down, so that you can be in environments and not fear, so you can sit in an airplane and not fear, so you can go to church and not fear, so you can sit at dinner and not fear. And I'm glad last week over here in America, they said folks who are fully vaccinated can actually walk around without masks and not fear. That means that if people can begin to walk around and begin to feel a sense of normalcy coming to them again, the whole anxiety and the whole stress is going to go down. So let's make sure that we are getting vaccinated. Let's make sure we are exercising. Let's make sure we are eating well. And then if there is anxiety going on in you, if there is worry going on in you, talk to somebody about it. Talk to somebody about it. Hey, this is how I feel. I don't know. Is it real? Is my feeling real? Am I being, because paranoia has really, really gone up. You may have a common cough and you may cough around somebody, even with your mouth covered, and they want to fight you. So let's make sure we get more information. Let's make sure that whatever calms us down, we do. I think that I'm going to end it here and leave room for any questions if anybody has a question.
Well, that was sharp, and thank you, Reverend Asai, for your insights that you've given. Well, before any question comes, just like to say that we have our General Overseer, Reverend Fitzgerald Donko, and Reverend Emmanuel Titilate with us. They have been listening to the discussion from a long time ago. So this is just a shout out to them. Let them know we know they are with us. Okay. So now, any questions? I can see a question. The question is, oh no, it's not a question. Okay. That's it's an information that we have. It says we should visit crowncoronation.com and enroll in for your COVID vaccine shots. Okay, so that's from Dr. Okulampu to everyone. I think everyone can see that in the messaging section. Okay, so we still like to say that we need some questions coming in. In the meantime, Dr. Sarbidiako, the issue about the psyche of the COVID patient, as you have described to us, well, you've described it in detail. Do you think that there's anything peculiar to the African as per the European?
I'm not sure if I am understanding you 100% correct, but I think that your question is, will an African or will people in Africa react to the challenges faced by a COVID patient the same way as a person in America?
Yes,
or in
that's
Europe?
the question.
And the answer is yes. Human beings are the same everywhere. The issue is that in our kind of culture, some topics are taboo, and we tend not to talk about some things because our culture prevents us from talking about it. So somebody feeling depressed may not talk about they feeling depressed because they think they will be looked at funny because of stigmatization, or somebody like Dr. Amma was saying, people are hiding. They don't even want anybody to know they have COVID and all that. People are actually dealing with depression. People are dealing with anxiety. People are dealing with OCD. And it is everywhere. Every kind of mental health challenge that people face is faced worldwide. Unfortunately, in our kind of system, we frown on some things. So, for instance, a woman may be raped by a cousin or something, or an incest. I'm just using this as an off-the-hook example, right? And in our kind of system, you may go and tell your mom or your dad or someone, and they say, shh, don't talk about it. This will bring disgrace to the family or whatever. And so we kind of keep some things internal, and it is not very helpful. But the answer is yes, everybody goes through it the same way.
Okay, but as you're talking about the Africa, we think in terms of community, I want to believe, and more in the European situation, it's more of an individual. How does that affect the psyche? Because you just gave an example of something like that. Here's a situation you're talking about, the family saying hush, hush to bring disgrace to the family. Whereas where you are, the issue is talking about the individual. So, do you have any comments about that?
So what happens is that individuals who are dealing with challenges suffer unnecessarily in Africa. I'm sorry to say that, even look at let me debate a little, look at our mental health system in Africa. You see people walking on the streets with no clothes on, and we say they are mad. And then we ignore them, or we just identify it with, oh, somebody cares them, or somebody put voodoo on them, or whatever. And these are people who are just schizophrenics, who might do well with just some simple medication, or you see somebody who is suffering from bipolar disorder and say, oh, this one is Bodamanitia, and then everybody ignores them and all kinds of things. And so people suffer unnecessarily. And then even when somebody is having hallucinations and they are hearing voices or something, they won't want to come and say it because then everybody will think they are mad, you know. So people suffer more needless pain and needless things they don't need to suffer. So that is the challenge. We have to be more open, you know. It is only been recently that in Africa, people can divorce and feel normal. Before in our society, if a person is divorced, everybody looks at you funny, you know. So these are everyday challenges of life. So somebody may be in a very bad marriage, an abusive marriage, and they don't even want to get out because they are more concerned about the community frowning on them than their emotional and mental health. And these are things that I believe in the process of time, education in the church and other social gatherings can help improve, because our mental health cannot be taken for granted in any area.
Okay, so in the context of the Christian, if you are talking about individual, the individual, how does the Christian community approach the psyche issue?
So for the Christian community, we have to get to the place where we understand that, you know, let me put it this way. It's funny coming from my mouth as a pastor, but not everything is spiritual. You know, we tend to spiritualize every single thing. But sometimes the problems and the challenges that people are dealing with might not be something that requires prayer, you know, or casting out of demons. It might be something that requires counseling. And so it's good to hear people out. Hey, after I received COVID, I am having a lot of anxiety. I'm having a lot of panic attacks, you know. I'm having all this serious anxiety. I'm afraid to return to work. I don't want to get to where people are, or I'm so depressed. I feel some kind of way because I've been stigmatized, and because of that, nobody wants me in their circle. I feel isolated, and I don't want to live any longer, and all that. You know, in the Christian circle, we should be rather supportive. Try to listen to what people are saying and give them encouragement. Of course, we will pray. But if somebody comes to tell you, hey, I'm suicidal, it's not about the demon. We don't have to cast out demons and all kinds of things. We have to understand the underlying factor causing or bringing that person to that place. What is causing the anxiety? It's not some devil. Something in your environment is causing it. How do we deal with that to reduce your stress level, your anxiety level, so that your OCD will go away? So we have to do more education in the church to enlighten people about some of these things.
Okay, Reverend, I think probably you say may not be a demon rather than is not, because we don't know everything. Yes.
Yes, we don't know everything. That's why I say that it sounds funny coming from me, but you know, we try to demonize everything.
I understand what you're saying, but for the sake of what you say, understanding, I wouldn't say a weak brethren, but I'll say for the sake of understanding, I think what you want to communicate to us is may not be.
May not be a demon. I agree.
Exactly. Okay. So you spoke about the church offering. We're still waiting for questions, please. I'm just filling in while okay, there's a question here I want to begin. Okay, no, it's not a question. So I'm going to ask another question then. You spoke about counseling, that the church should be able to offer counseling, listen more, and so on. So are you suggesting that we need to strengthen our counseling departments and so on, or we should set up counseling departments? And maybe I should ask, what do you mean by counseling?
So when we talk about counseling, right, there are different versions of counseling. A lot of times the church does Christian counseling, which is good, right? But let me even digress and move away from mental health. If somebody comes to you and the person is having financial challenges, you know, that person needs financial counseling and financial guidance. You know, yes, we can do it according to the word of God. Or somebody is facing certain challenges that are peculiar to them. We must have people in the church. And I'm happy for Harvest Chapel, where we have all these doctors and all these counselors and all these people who can actually see and understand things in better ways, you know. But as a church, we have to understand that people deal with a lot of issues, you know, and we can't take anything for granted. Let me give you an example. Somebody is in a church, and for instance, they have a court case, they have been falsely accused or rightly accused or whatever it is, and that person has to go to court or whatever, and they are dealing with anxiety, and they are dealing with panic, and they are dealing with all those kind of things, right? Because they don't know, how is my case going to be adjudicated? Am I going to be sentenced and go to jail? Am I going to be disgraced? Am I going to whatever? This is something that is real to the person. You know, we can pray for the Holy Ghost to bring calmness and whatever it is, but unless you are able to help the person process their emotion and process their fear, you know, it can kind of move on and generate into something else. And that is where, in worst case scenarios, you see people doing things that sounds like, oh, it's so unreasonable. Why would that person do that? Because when people don't have anywhere to turn or anything to do, that's when they actually go on and proceed and do the most irrational things.
Okay, Doc, so bringing you back to the corona, because we're talking about the COVID psyche.
Yes.
What are some of the stages that people go through for the way of information? What are some of the stages? I mean, you may have mentioned a little bit of it, that people go through right from the process of symptoms down to recovery.
So the biggest, the stages is different for different people, depending on the kind of exposition they had and the kind of understanding they had, as well as even their faith level, right? If somebody is like, listen, being diagnosed with COVID is no different from being diagnosed with cancer or being diagnosed with some kind of disease out there, right? Somebody may be told that, hey, you have cancer, and then they'll be like, okay, I can beat this. What am I supposed to do? What can I do? Maybe exercise, maybe chemo, maybe changing my diet, maybe whatever it is, and they'll beat the cancer. Another person might get cancer and they see it as a death sentence. And actually, as you think that's what you are, you will end up dying, you know. So when a person gets COVID, right, number one, the first thing that you must tell yourself is, okay, I have COVID. I'm not the only person that have had COVID. I know people die from COVID, but a lot of people get COVID and leave, and therefore I'll be among the people who leave. That positive self-talk to yourself is a very first encouraging thing. So I'm going to live through this COVID. Even when your situation is worsening, I will still recover. I will get better. It might be worse, but I'm not going to the grave with this. So that ability to have hope is very important. That ability to have hope that I'm going to come out of this okay helps a person recover quickly and reduces the amount of stress and anxiety they deal with. And so that processing, okay, I have COVID, it's not the end, it's just a stage, just like I'll recover from a flu or I'll recover from whatever it is. It's the same thing. But if you tell yourself, oh, it's the end, this is the end of me, I'm dead, I die finished, then you're actually going to not help your case or help yourself. It's going to take you longer. I don't know if I answered your question.
Okay. Well, you have surely done so. Two things you have said, I think are very good about having a positive thought, and then also recognizing that hope helps recovery. Negativity does not help you, but hope will help recovery. Okay, we have a hand up, and then maybe we can come back to it. We've got World Outreach. I don't know who that is. Whoever you are. Okay, Reverend Fred Gardner, kindly ask your question. Hello, Reverend Fred Gardner. You are still muted. If you're going to, okay. I think the hand was up only. Okay, so you don't have any hand up right now, unless you see a hand up. Okay, so just by the way, the information that Dr. Pope gave, it's for persons who have not had any shots. That's those who would register to have the vaccine. It's for persons who have not had any shot. So if this is your first time, it's for you. It's not for those who would be having a second shot. That one, you need to get more information as to where you can go. But this one is for those who have not had any shot at all, first shot. So you are registering at crowncoronation.com, where you can enroll for your COVID vaccine. Okay, so are we still having anyone with a question, contribution? You can ask any question relating to any of our speakers that have spoken, or if you have a contribution to make. And then more importantly, if perhaps you are with us on this platform and you have experienced COVID and you are brave and bold enough, as a Christian, you should be bold, and you want to share your experience with us, you may do so, maybe relating to the psyche or stigmatization or whatever else. So anybody? In the meantime, any question? Share an experience or a question. Okay, maybe I can call some people and ask them to tell us if they know anybody who's had it and the experience that the person had. I think there are a few people here who have experienced a family member, somebody. Anyway, well, maybe I'd like to reveal to the whole world, first of all, that I have had COVID. And this issue about the psyche of a COVID patient is quite a relevant one. And it's important to know, because throughout the process of the COVID, there are various stages. One, you see the symptoms coming, then your mind starts going, what's happening? Then maybe you go and do the test. And then after the test, you're waiting for an answer. Your mind is in a certain state. When the positive result comes, you're thinking about it, what's going to happen? Is this going to be the end? Then you have to start fighting as a believer with your positive thoughts about God's word and so on to get your mind in the right place. And then throughout the process, sometimes you don't know what's going to happen. Maybe when the symptoms are so severe or the reactions are so severe, you're wondering, what are you going to do next? Maybe you have to start writing all your passwords and pass it on to your wife or your loved ones. Many things can go through your head. And but throughout the process, these two things that our doctor has shared with us, they are the things that count. Having a positive thought based on, especially on the word of God, and then having hope. Hope is a very strong one. Hope helps for recovery and also fighting negativity. Dr. Asari Bediako, would you like to make any comment about what I've just said?
You are actually right. Having that hope is really critical. If you believe, and everything you experience or that you said you experience is actually a normal experience for most people. That a million thoughts may run through your mind, is this the last time? Should I write my will? Should I give my passwords out? Should I prepare for my funeral? Will I see people again? And all kinds of things, So everything that you said is absolutely true and correct. And a lot of people feel it, and especially for those who get the serious acute ones where they have to be put on oxygen and come close to dying, their life is never the same again, even after you recover. And then even after folks recover, they don't want to get close to people. They know they have had it, they know they have recovered, they know they are probably immune, but that fear alone of what you went through can also not just let people be afraid of you, but you also be afraid of people that can somebody give it to me again. They say it's only 5%, but 5% is a huge number for somebody who has come close to death before. So those are realistic things you are talking about.
And let's not forget the issue of support from our church, especially our church leaders. You should not be shy or afraid to talk to your pastor or your head pastor to pray with you or to support you, especially if they know about it. It's good. You know, when people get to know, goodwill is one thing that is a very powerful thing. The Bible says and tells us that the angels came and told us about goodwill towards man. And that was very powerful for man to know that there's goodwill with you and to know that maybe you have support from your pastor. And I did. I mentioned it to our leaders and they prayed with me, and I believe they had me in their mind and with goodwill. Amen. Any contributions? Dr. Pope, are you there? Dr. Cranting, and many more. Pastor Hager, I can see you there. Yes, please. Reverend Emmanuel Titilate's hand is up. Reverend Emmanuel,
hello,
please,
can you hear
go
me?
ahead. Reverend Dr. Pope, can you hold on, please? Reverend Emmanuel would like to contribute.
Yes, myself.
Yes, thank you.
Hello.
Hello.
Okay, hello.
Yes, hello, Reverend Emmanuel.
Can you hear me?
Yes, we can.
Okay. I'm wondering why we are dealing with only post-COVID, what do you call psychological effects. But there are people who haven't contracted COVID and also have the tendency of behaving in a certain way because of the fear of COVID.
Yes.
Some are shying away from people. They don't want even people to touch them. They don't want. There are a lot of reactions. I thought Dr. Saudi will touch on those areas as well, and probably counsel us on how to behave and how to handle the issue of knowing that COVID is around, and because it's not only those who have had COVID before who react in certain ways.
Yes.
So I don't know. I don't know if my question is very clear, but
yes, it is.
I'm trying to.
Yes. Yes, I believe it is. Doctor, sorry.
It is very clear. What you are saying is true. And a lot of those feelings and a lot of those behaviors are irrational and they are based on paranoia, the fear of something, extreme happening. So people are extremely afraid. I tell people, especially here, there are folks who you haven't seen in church even for about a year and a half. I say, you go to the grocery shop to go and shop, but you want to say that there's COVID in the house of God and not at the shop. The truth is that it's a lot of fear, and the fear is due to misinformation. Misinformation creates fear. And again, the lot of panic is also due to all the social media information people are taking. And when people don't have understanding, they think like Dr. Amma was saying, at first people think that even when you sit in a room with somebody with HIV, you catch HIV. It's the same way. People are afraid that every cough is COVID, every cold is a COVID, everything they imagine. So it is the mind imagining all kinds of unrealistic things. Our mind has a funny way of behaving. Sometimes it pushes people to the place where they some of the things people imagine you can't even phantom. But if we can come to reality and calm our own mind through meditation, we keep on telling ourselves, this is not realistic. I am overreacting. I need to take a deep breath. It is not as bad as I think it is. It is not looking the way I think it is. There are even people who have lived in households with people catching COVID and they did not catch COVID. So it is not as terrible as it is. So it's about we calming our mind down. Everybody does that differently. But if we believe I don't want to call it the lie, but the irrational thoughts our brain is telling us, if we choose to believe that, then we are going to imprison ourselves and we are going to isolate ourselves and we are going to behave funny. Like I said, that father who shot the son, it was out of fear. So if we can overcome the fear, then we will be much better people. So we have to also teach people how to overcome the fear. And I'm sure that as more understanding is coming about COVID, people are going to be a little more comfortable as we are having the shots and things. Our people are going to be more comfortable and they are going to interact and behave appropriately in society again.
Okay, wonderful.
All right. So I just wanted to chip in something here.
Yes.
This is a platform of believers, and I believe very much that with all that our pastor has enumerated as being the effects and how we can deal with them, I believe very much that we can see some basic scriptural principles underlining even the practice that he does for other people. Meditating, he has mentioned it, and convincing your mind, telling yourself that I will choose to believe or hear or think right is one game changer. I think that, especially with this platform where most of us are believers, even if you're not a believer and you're on this platform, it is an opportunity for you to get to know that scriptures have the power to hold back foul thoughts which eventually lead people to suicidal tendencies. And God has given us the ability or the power to cast any thought that we deem is not in line with scripture down. 2 Corinthians chapter 10, verse 5. And so yes, we are in an uncertain pandemic we have never seen before. But to garnish and to help ourselves and to garnish what our pastor have said, I think we should go back to those scriptures that tell us about what we should allow in our thoughts and what we should not allow. Two key scriptures, 2 Corinthians chapter 10, verse 5, Philippians chapter 4, verse 8, tells us what we should allow and what we should not allow. So probably my advice, go back to those scriptures, through it, and begin to meditate on that. God has spoken that we should not allow to stay in our thoughts. Scriptures has told us to use to bring down, casting them down, and rather replace them with all the good things stated in Philippians 4, verse 8. And I think that we of all persons would be a better place to encourage other people. Your rendition and your God richly bless you.
Hello. So we have a question. Then I think I'll sign off and hand over to Dr. Pope, who will, I believe, end us, maybe invite the general overseer. We have a question or a comment. And it says, with the new Indian variant going up in the UK and lockdown being eased, we've had a situation where people are fatigued with wearing masks and so have refused to wear it in church. But others also feel that that is irresponsible and have decided if the church doesn't enforce COVID protocols, then they will stay away from in-person service. How should this be handled as the Prime Minister has only given guidance? Okay, so Dr. Pope, or maybe leadership.
Okay, so I can see the hello.
Yes, Doc, we hear you.
Yeah, right. So I can see the concern of the individual. In fact, last time my son came back from school, I think the question he was posing to the mother was that the mother should tell the teacher to give them briefing break, because they keep putting on the masks the whole period. Even when they go on break, they are supposed to keep the mask on, and they want a break for putting on masks. And so I can agree with you that you can be fatigued from wearing the mask, especially if you are in a place that is required of you to put it on for a long period. And but you see, when we look at it closely, how many hours do we spend in church? You could see that we don't spend that much time even in church. And once you are in the open and there are no persons around you, or probably you are in your car alone, that can go off for you to have that break that you need. And so you would have to look at your surroundings and be sure that for you to take that break. And when you see that you go into an enclosure or where there are other people very close to you, you put it on back. And so probably it is up to the possibility of a variant which can come in. It is there, and it's not something that has not happened. We have seen what is going on in the other countries. So there is the possibility, but then we can go around the fatigue by trying to understand our environment. I see people alone in air-conditioned cars with all the louvers rolled up and still they're in a mask. So if you do that, and by the time you get to workplace, you have to, let's look around and apply some a healthcare worker as to when you can take such breaks. And I think that is going to help a bit.
Okay.
Yeah, Pastor Pope, I have a question.
Okay.
I visited the website and I'm looking at the qualification criteria and looking at those who are included in this. We have volunteers without clinical evidence of COVID-19 infection aged above 18. And we have, you must have a mobile phone with access to the internet for data collection purposes. And then healthcare workers based in a primary, secondary, or tertiary healthcare setting with a high risk of developing COVID-19 due to their potential exposure, blah, blah, blah.
Okay,
blah.
Reverend.
So that means that somebody
Hello.
like me, I don't qualify, right?
Hello. Okay. Dr. Pope, maybe you can answer that then we finalize.
Yes, in a way, if you find yourself in those categories, you are allowed, because this one, it's actually also a kind of research which is giving that offer. And so whilst you are going to be giving the vaccination, we would also be following you up to see if it is effective, so we can report about the vaccination we're doing in Ghana, the degree or the effectiveness of it. So these are a cohort we are taking out of the population to verify the degree to which individuals are able to build antibodies to the vaccine that is going on. That's why there are a few restrictions here and there, and it's not everybody. If you've had COVID already, you are not entitled. If you've had the first jab, you are not entitled. So at the end of the day, though you're going to get your and right on time, because we've secured enough vaccines for all those who qualify. Because we want to also tell a story. Some people may not qualify for that. So you got the advantage.
Okay then.
Okay. So in other words, I don't qualify, right?
If you've got the first shot already, yes, then you don't.
Oh no, but I've not taken any shots. But I'm saying that looking at the inclusion criteria, I don't, apart from having access to a mobile phone.
Hello, please. I think this aspect of it, probably you can talk to Dr. Pope on the side.
Oh, okay,
so
okay, thank you.
Thank you. Yes.
Yes.
Right.
Yeah, I think that's very correct. All persons who think they need some further clarification, just call me on my line.
Yes. Okay.
Okay, thank you.
Wonderful. So thank you very much, everybody, for being a part of this. I am Nana Folsom of Harvest Chapel. It's Tequila Temple. And thank you for making my work easy. I think I would like to give we don't have a mic, but I'm giving the mic back to Dr. Pope for him to bring the ceremony to a conclusion. And I believe you asking Reverend Fitz. So Dr. Pope, thank you very much for the opportunity.
All right, so I would want to use this occasion to thank all our resource persons who, for this past 2-3 days, have offered to come to enlighten us. It's been a short notice. It's been something that would have to try and put together quickly. But when we called on you, you were able to come up and share something with us. And I believe very much that we've all benefited from all this talk. So thank you very much. Some have been on the field, but had to have time to squeeze in to give us the talk. Thank you very much for the sacrifice. And for all of us who attended, I very much believe that we've learned something that if we don't use it ourselves, we can pass it on to others. In all this, what we seek to do is to remind ourselves of what we can do within our limit. But then at the back of our mind, remember that in all this, we have a God, and He is the ultimate healer. When things go bad, as have been explained by various speakers, and we tend to fret and start getting confused, let's remember that we are not alone. The Lord who has called us to Himself, He is the ultimate healer, and there's nothing that is impossible for Him. And so as believers, yes, we might have all this knowledge, but our first point of call is to cry upon Him. And He has given us His word in the book of Psalms 91, in the book of Isaiah, that yes, the devil might do all he can to fashion out weapons against us on many fronts, but then He, the Lord, will frustrate all those weapons, and none of such weapons will come near us. I want to thank you all for coming, and God richly bless you as we move ahead in our daily activities. God richly bless you.
Hello.
Yeah, Uncle, and I've completed my shots.
Yes. So we'd like to maybe invite Reverend Fitzgerald Donko to say the closing prayer, give a comment, any remarks, please. And then the closing prayer to bless us all.
Thank you very much. We thank God for a successful end of the health weekend. And we started with a healing service. We had a successful blood donation, and we've had 2 successful seminars. We thank God for that. We are asking for God's protection for us. We are asking for God's provision also for us. We are asking that somehow a favorable wind will blow and we'll see the end of this COVID-19 pandemic. And we are also praying that we'll be there for each other, to be supportive. Knowledge helps us to fight the war and to win our battles. We've received a lot of knowledge. We want to use this knowledge to fight a good fight, to win the war against this pandemic. So we just want to say a word of prayer. I want to join Reverend Anna to thank the organizers and also our resource persons, both for yesterday and today. And I ask that God will replenish every virtue that has gone out of them. God will favor them. And for being of service to the kingdom, God will also order their steps and show them his kindness. Shall we pray? Father, we thank you so much for the successful end to our health weekend. We commit ourselves into your hands. We use this platform to commit every member of the church into your hands. We ask that you build a hedge around us. We ask that you preserve every life, every family. We ask that we'll use this knowledge to fight against this pandemic. Above all, we ask that we will put our trust firmly in you as our healer, as our refuge, as our deliverer, and as the one who lifts up our head. We commit the days ahead into your hands. We pray for grace to abound. We pray for wisdom in the decisions we take. We pray for a discerning spirit. And we ask that together we will serve you, build your kingdom, and be the light of the world and the salt of the earth. May God be with you. May he hear and answer your prayers. May he straighten every crooked path. May he heal the sick. May he strengthen the weak. May he grant comfort to them that may be sorrowing. May he grant to faith to the faint-hearted. And may his presence carry us for the rest of this month, the rest of this year, for the days ahead. In Jesus' name, amen.
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 Amen. Thank you very much, Reverend Fitzgerald Donko. We'd like to let everyone know that tomorrow morning we have our morning glory prayer time from 5 a.m. to 6 a.m. And then also this week, we'll be having our end of month prayer and fasting from Wednesday to Friday. We'll meet in the evenings to pray. So kindly take note of that. Thank you very much, everyone. And God richly bless you.
All right. God bless you.